Hello everyone. Very good morning. This is sharp 9:30 and we have started our event, our live event where we are going to celebrate Women's Day. I hope you all are excited about it the way I am. So we have a bunch of activity planned up today. Let me share my screen and show you what exactly you can expect in today's event. All right. So I hope my screen is visible to you all. Welcome, welcome, welcome. So women's health is, I think, the need of an hour. Women need that attention, that special attention that is kind of missing right now these days due to the unnecessary burdens, or else I would say a burden of responsibility that women faces every single day. Somewhere due to this, the health is something that goes and takes a backseat. The agenda or is the purpose of doing this event or is organizing this event is to make sure that we highlight women's health again. We showcase the power, the possibilities that women have in today's day and age to take care of her own health in her own hands. This year, we are prioritizing musculoskeletal health for women. And under this particular topic, we are focusing and ensuring that we cover every single possible things that a woman should keep in mind in terms of her health to ensure that she stays healthy, happy, and well. So, without wasting any due time, let's start today's event. Let's start today's plan of actions with understanding today's agenda. So today's event is divided in two parts. First half is going to be a panel discussion which we will start sharp at 10 a.m. After which we have lined up two product pop-ups. So what are these product pop-ups? These are nothing but the different products that we have kind of curated, and we want that all women should use them and should know about them so that they can not only take care of themselves but they can help each and every woman around her to stay happy and healthy. So the brands that we are showcasing today is Respire, Cure by Design, Anukul, and Mayavni. In the first half, we have our Cure by Design and Respire to be showcasing their products. And in the second half, we will have My Avni and other brands which will be present. At the same time, we have a very interesting talk by our dietitian, Ms. Ritu Kapoor, who would be talking to you about understanding women's hormone. So this is the first half. That's how it's looking like. I will not reveal the second half because I want to keep certain things a little bit more, uh, I would say, awaited, and that's why I'll explain them or share with you what's in the next session after some time. But before we move on, today I would like to give you a brief introduction. I would like to talk about why women's health is the top priority and should be the top priority for our country. And I don't think only country, the entire globe. If we look at the data, 1 in 3 women over 50 suffer from osteoporosis today. Some common issues like arthritis, back pain, weak bones have become so common that these have become the leading cause for chronic pain in women. But why women's musculoskeletal health matters? So, first, let's understand what is musculoskeletal health. Musculoskeletal health is something that involves the well being of bones, muscles, joints, connective tissues, which supports movement, strength, and stability. Good musculoskeletal health prevents pain and mobility issues, promotes activity and independence. Musculoskeletal health is also responsible to ensure that other systems of our body, which are our reproductive health, sexual health, mental health, physical health, and even emotional health, are taken care of. And that's why musculoskeletal health of women is very, very, very critical. So, now let's also understand how musculoskeletal issues will affect women specifically. Women who suffer from menopause are more likely to go through bone density loss. Pregnant women are more likely to go through pelvic floor and lower back strain. Women who have sedentary lifestyle are more likely to have weak muscles and stiffness. And that's why proactive approach is the key. So, what women can do in order to make sure that her physical well being is taken care of? And I think there are four pillars to it: exercise, nutrition, mental well being, and sleep. Today's entire event is somewhere dedicated to these four pillars. We are going to cover each and every aspect of these four pillars in today's session. I will be keeping on coming in middle and talk to you about different aspects of women health. But today, let's first start our session, our conversations around the different challenges that women face in their day to day life. So I'll come back here and we'll ask some questions to you. So, we have a panel which is starting sharp at 10 o'clock. Okay. Now, what I want you to do is, I want you all to come up and share in the chat box the challenges that you feel women experiences in her day-to-day life. Anyone, feel free to put it in the comment section. Let's hear out your own challenges. Anyone, I'm waiting here. Feel free to put it in the comment section. Anyone here who would like to put? Okay. All right. So I got one comment here: work and home balance. I think, yes, this is a very critical part, and a lot of women face this challenge. Okay. Anybody else? What is the other challenge you feel you face when it comes to women's health, or else overall women's challenges? Any other challenge? Time management? Somebody's typing time management. Yes. Yeah, absolutely agree. So this is somewhere very similar to what Dr. Deepal said, that work-life balance, home balance is a very critical part, and time management is also something which if, is a day-to-day challenge for, I think, every individual. All right, what else? Okay, my chat box is live here, and I'm just going through all the comments. Work life balance issue, time management, anything from the health perspective. What are the health challenges that women faces? Anyone? Okay. How many of you think that osteoporosis, weak bones, is a very critical challenge in women's health? Anyone can just type yes or is just raise their thumb in the chat box. All right. So I see some comments. Yes, yes, right. So osteoporosis, a lot of women suffer from it. Apart from that, what else? How about weak pelvic floor muscles? Pelvic floor muscle weakness is a very critical part, which leads to a very pressing problem that women face on a day to day life, which is urinary incontinence. How many of you root for that? That yes, this is something which is a challenge. You can just put a thumbs up or just write yes or no. Would like to know? All right, great. Okay, so we covered time management challenge, we covered work and home balance, then we covered osteoporosis, we spoke about the challenges in terms of weak pelvic floor muscles. What other health issues that you believe you is a challenge in today's time for women? All right. Okay. Yes, that's also true. Sleep. Women lack sleep. Sleep, adequate rest time is something which is missing in women's life, which also impacts her day to day living, isn't it? What else? Apart from sleep, apart from osteoporosis, nutrition. How about nutrition? Some key aspects that women miss out in her nutritional well being is something that is also missing. Great. All right. So these are some of the challenges that we spoke about, and we will be talking more about these challenges as we go forward in today's session. So this is just a warm up. What I'm trying to do here is I'm just trying to set up context for all of you guys so that this entire day, which we are going to spend together on this YouTube live stream, stays meaningful to you. So stick on with us, guys, as we move on forward with our series of activities. But I want to quickly show you a video now about health Q rehab, why we started health Q rehab, what exactly our mission is, vision is, what exactly we want to achieve through health Q rehab. So I will navigate you all through our YouTube channel because I want you, and this is a small request from our side to you, that please subscribe to our channel because we genuinely think that we want to add value to people's life. Just give me a moment, and here we start our video. Okay, so I'll just share my screen.
Lack of accessibility. Even though, hi, I'm Physio Meghna Dave. I'm the founder and CEO of HealthQ Rehab. I am a neurorehabilitation physiotherapist who later on turned into a YouTuber and now an entrepreneur. My vision with HealthQ Rehab is to ensure that we should be able to help 1 billion people across the globe to move better in their life. The journey of HealthQ Rehab began a couple of years back when I stumbled upon a study by WHO which showed that 2.3 billion people across the globe will need physiotherapy and rehabilitation services by 2030. The study highlighted four important challenge areas to make sure that the physiotherapy services are available to people. The first biggest challenge was lack of awareness itself. Many of the people don't know how and when physiotherapy can help them. The second big challenge is lack of advocacy about physiotherapy and rehabilitation services from other medical fraternity. The third challenge is lack of accessibility. Even though the urban cities has got good access to physiotherapy and rehabilitation services, the remote areas in the country and tier 2 and tier 3 cities of the country still face challenge when it comes to finding quality physiotherapy and rehabilitation services. And the last but not the least challenge that study identified was an out of pocket expense. Majority of time rehabilitation services are not covered in insurance, and this is one of the biggest reason people drop off and don't take their services for a long period of time. That's not all. When we were doing our own research, where we were interviewing a lot of people, we also found out that the lack of engagement in the entire therapy program was also acting as a very big barrier in encouraging people to stick or hooked to the rehabilitation services. And when we were doing our own research, when we were trying to reach out to patients, talk to our patients, we also identified that lack of engagement in physiotherapy session was one very important factor which made people discontinue their physiotherapy services. When we reached out to patients and we interviewed them, we also found out that the patients who found the therapy more engaging were more likely to stay continued with the therapy programs. Engagement plays a very crucial role. Patients' motivation plays a very crucial role when it comes to continuation of physiotherapy services for a long period of time. Physiotherapy is not a procedure, it's a process. And we want to ensure that we be the partners of our patients throughout their journey, throughout their process of recovery, of healing, of getting better. That's why we decided with HealthQ Rehab, we are going to be completely digital. We combine online, offline, and home care services. At the same time, we also combine group care services as our programs because we genuinely believe that no matter what kind of physiotherapy service a patient needs, no matter when they need it, how they need it, we should be able to provide it to them. We also decided that we are going to keep our physiotherapy services multi-speciality in nature. We have bought a multi-speciality approach when it comes to our therapeutic programs. The four key areas where we follow when it comes to rehabilitating our patients is neurological rehabilitation, pediatric physiotherapy, musculoskeletal physiotherapy, and women's health physiotherapy. And third most important thing that we keep in mind while designing our approach is the fact that we are very much process and framework driven versus a procedure driven. Last but not the least, we ensure that we have a very much program or framework driven approach. We don't rely on a single procedure or multiple type of procedures to ensure that we can help patients. We believe that we should be there with our patients throughout their journey of recovery, throughout their journey of healing, throughout their journey of overcoming an impairment. And we ensure that we should be able to provide them various solutions, various options of treatment throughout this process. Till now, we have been fortunate enough to help around 10,000 plus patients using different modes, different mediums, online, virtual, group, physical one-on-one, home care, etc. And our vision is very big. We want to serve patients globally, and that's why we are here in as a team with a very long-term mission. And we believe that one day, for sure, we would be able to help 1 billion people across the globe with the help of our physiotherapy and rehabilitation services.
All right. So that was a quick video where we spoke about what exactly we are trying to do at HealthQ Rehab. Thank you so much for staying hooked on with us for today's event. Now, moving forward, I would also like to talk about some of the programs and activities that we are running right now at HealthQ Rehab. Now, why this is something that I'm putting forward right now is because this is very women specific, and we genuinely believe that we want to serve women. Women are the 50% contributors to our society. And if we don't have unique programs, specialized programs designed for them, then we are not able to serve to our society well. So, what is something that we have to offer to our existing women of India and globe? Let me again get you to the screen that I took you some time back. So, we are trying to cover the four important aspects of women health, which is exercise, nutrition, mental well being, and sleep. We believe that there are a lot of things that women needs to focus on when it comes to her well being. Some important things that women should do is to ensure that she gets regular checkups. Regular checkups are very critical for her to make sure that she's aware that where her health lies. We ensure that we provide them those different assessment methods, techniques through which they can stay aware about their own musculoskeletal well-being. We want to ensure that we help women to manage her stress. That's where our psychotherapy services comes into the picture. We want to ensure that she takes healthy diet. That's where our nutrition services comes into the picture. We want to help women to take frequent breaks throughout the day. And for this, we have come up with something called as Safe Exercise Program, which is a free downloadable exercise course for anyone who join our community. This exercises is something that women can take or practice from anywhere she is at. Maybe at work, maybe at home, maybe watching TV. All she needs to do is ensure that she finds out that 5 minutes of time and she do a quick set of exercises so that she gets those break from that monotonous posture that she goes through throughout the day. We also want to ensure that she exercise regularly, and that's where we have come up with pain-free workout program. We know that alcohol is not good for women. This is something out of context, but still has a very important role in overall women's well being. And that's why a mental health support helps women to overcome these kind of addiction related challenges. We want to ensure that women gets enough sleep and she have regular self evaluation methods with her. That's where a collaboration with different product companies and introducing different products to a woman throughout her recovery timeline is something that we take responsibility of. So that's our women's health approach. A women's health approach that provides holistic recovery programs that's multidisciplinary in nature and which is phygital in nature. Some simple programs that we have to offer to women are personalized consultations. This can be taken virtually, or else you can visit our center, which is located in Bangalore. Or if there is a need of someone to come to your place and get this consultations done, we try our best to get it happen. The sessions that we do offer are also combination of online and offline. And last but not the least, we have different types of therapeutic group workout programs that suits to women's need. Some of our ongoing programs are pain-free workout, face yoga, and women's strength training. A comprehensive one-on-one consultation focuses on posture and movement analysis to identify imbalances and mobility issues. We focus also on strength and flexibility training. We focus on pain and functional screening. At the same time, we focus on customized action plan. When it comes to our one-on-one session, the phygital session, these sessions are blend of online and offline because we do understand that traveling every single day is just not possible for women. That's why we try to accommodate online and offline services for women so that she can take control of her own health. Next comes our workouts, the pain free workout. This targets women who are in her 40 plus age group, who have already existing conditions, who is going through some health challenges and is just not able to work on her strength and conditioning. Pain free workout ensures that she stays pain free while doing her workouts. Strength and conditioning at the same time focuses on taking the women to the next level. While she has recovered after her injury, or else she is going through some rehabilitation process, or else if she is recovering from any post surgical injuries. We have Smile Strong Program Mini, which is targeted towards people who have got facial impairments like facial paralysis, stroke related facial paralysis, Bell's palsy, etc. And last but not the least, the face yoga session ensures that we help women to focus on her longevity. We help women to look young, glowing, and happy in her own skin. So these are our programs that we are running at HealthQ Rehab. In today's session, in the second half, we'll also give you a live experience of how a women's strength and conditioning group online session feels like, looks like with our expert trainer. So stay tuned and join us in our second half session as well. So, why we believe this approach is better when it comes to women's health? It's because it's effective, it's efficient, it's affordable, and it's accessible. So, that's my ask to you all. A strong woman is a healthy woman. And that's why join our program today because we want you to be strong and healthy. So looking forward to connect with you. If you have got any doubts, any questions, or anything that you would like to ask us, feel free to put it on the comment section below, or else we are just putting our phone numbers here. You can reach out to our team so that you can ask your questions, your queries if you want any of the services or support from our end. So now we have 2 minutes left to start our panel discussion. So let's wait for our panelists for this 5 minutes break and then start our conversation. Hello everyone. Very good morning. Hi, Sutapa. Hi, Dr. Deepal. Thank you so much for joining.
Good
I think
morning.
you're, yeah, great, great. Happy Women's Day to you.
Very happy Women's Day to you and everybody else who's watching, and also Dr. Deepal.
Great. So, we'll just wait for one more minute for other panelists also to join. They are just trying to join in, and then we'll start. All right. So, we have everyone joining in some time, but meanwhile, I thought let's start our conversation. So, yeah, Sudapa and Deepal, can you just unmute yourself and just come on camera?
Hello everyone.
Hello, hello, hello. Happy
Hi,
Women's
hi.
Great. So I hope you have a very nice sunny morning today because Bangalore is also very sunny these days. How about Ahmedabad, Deepal?
Yes, it's getting hot now, day by day.
Great,
Pleasant in
great,
the morning, but by noon, you feel like go inside.
great. Yeah,
Yeah, I mean, Bangalore's just never seen it this hot already, and let's just say it's not normal Bangalore weather anymore.
hopefully we get rain soon. All right. So, guys, before we start, let's have a quick introduction about each and everyone. And what I want you to do is a little different, starting from Sutapa. If you can just talk about yourself, and you run a complete women's team, and that was a very specific reason I invited you on this session because the theme of today's session is the challenges that women face in day-to-day life. So maybe if you can just talk from your perspective about yourself and what you think women of today's time should highlight on or focus on. Please, your thoughts.
Very wide question. We can go on and on, but I'll try to keep it a little brief. So, a bit of background. I started my career as a journalist, and I did about 13, 14 years as an active journalist. Again, very physically and mentally strenuous as a job, especially um, television. And then, I reported across print and online as well. But it was quite strenuous, I would say, on all aspects. And I started Dharma Media Consultants about this is our 10th year running. We are an award winning brand building and communications company. um, primarily work in the corporate, startup, PVC, and impact sectors, wherein we create communications and brand building strategies and execute it for various companies. Our team is primarily women driven. Meghna, since we last spoke, we've actually also been inducting a few. We're doing reverse hiring, reverse gender diversity. We are bringing in some men as well. It was never a no male policy. That was not a conscious decision, but it was conscious on my part that we give opportunities to as many women professionals. And the sector is such that there are more women who are kind of active and operational there. We've I think about a year ago we were also recognized by Exchange for Media as one of the best organizations for women empowerment. We are a small team, we are a small business, but at the foundation of everything, we do keep the fact that women are a major part, integral part of our team, as the thinking, as the ethos. And the reason we keep that is because with women, we see that there are different challenges which come across their career. And my hope and endeavor, and I hope a little bit of a mission, is to try and keep as many of them in the workforce and not let them drop off. So for us at this stage, for women in business, for women who are working professionals, I think the greatest challenge is to keep working, because long careers are not as common for women as they are for men. And if you've taken a break, getting back is as challenging. And there are many factors, and I'm sure all of us here have our own stories and things to talk about. So that is from the organizational point of view. I mean, can we also, like today, I also write a column. I have a few podcasts which I do, and this is the theme that we keep talking about, that we keep saying that we need more women in the workplace. We want greater participation of women in the workforce. The country needs it, the households need it. Look at where prices have gone today. Two people working is always better, right? It's inflation is so high, you need two people working. But at the base of it, and today in my column I've written that there is a mindset change which we women need to do for ourselves. From the time that we've grown up, most of us, not all, but most of us have been encouraged to give more priority to family, home, household. Career is always a second thought. It's always it's okay, it's great if you're doing it, but chhodna hai to chhod de. You know,
Yeah.
it's it's unthinkable for a man in today's society, which is also a separate pressure on men, and that is also a pressure which is unfair. But to be at home and do nothing, or only to take care of kids. But for women, it's like it's accepted. So somewhere, for me, through the few people that we work with and the many people that we interact with, the idea is, let's retain women in the workforce, give them flexible opportunities, give them hybrid work spaces, and allow them to thrive in a workplace where you're adequately supported to take care of your other responsibilities, which are your parents, your children, your household, etc. The other thing is, let's also reset our own mental biases towards ourselves. Our demands, our ambitions are as important as male ambition. That reset has to come from all of us, and that has to percolate down to the younger generation also, and who are, by the way, they are much more aware of these things than we were probably. But these are two things which I find myself more and more trying to push. We all make our little attempts. We don't know how much it will work. But I'll pause there because we have everyone else here who I'm sure have things to say, and I can go on and on. So I'll take a pause. there.
No, but very true, Sutapa. Like, I absolutely agree to this. We need to retain more women in workforce. Women are far more talented, and their talent is just going unused. And I also would add up into that point that yes, today's women should stand for themselves and should be an equal contributor to the economy the way the men are. Moving to Dr. Deepal. So, Deepal, please give a small introduction about yourself and what are your thoughts on the challenges that today's women face?
So,
I think you're. Yeah.
yes. So, as she explained, that there are many challenges in day-to-day life already. So, if I focus on the health, women's health, then the biggest challenge is to maintain a good health, physical and mental both. But mainly, I'm talking about as a physiotherapist perspective, more of our physical health while working, when you are balancing the work and kids and family. At that time, give priority, give time to yourself, and do exercises. Prioritize yourself, especially after age of 35, when they are at their peak of career. Kids are growing up, and also the menopause is about to start. So at that time, to maintain a good health is quite a bit of a challenge in present scenario. We don't find time for ourselves.
Very true, Deepal. So we have Aditi also who have joined us. Thank you so much, Aditi, for joining. Moving to Swati. So Dr. Swati is also women's health physiotherapist. So Swati, what do you think? And also, please give an introduction to the audience present today.
Yes. Hello, everyone. First of all, a very happy Women's Day to each one of you over here. Myself, I'm Dr. Swati. So, I'm the women health physiotherapist. I'm certified diet counselor, fitness trainer, and at the same time, I take care of the lifestyle coaching as well for the clients. The same thing like what we all were talking about balancing, the work-life balance as well as taking care of the things. This is what I feel like, in my area, wherever I stay. I'm from Hyderabad. So that awareness is not there. So we have been conducting these sessions. So whatever were telling till now, that's the same thing which people are having the issues. They don't find time for themselves. They have a lot of health issues. When they ask, they have several questions to ask about their health. But when we ask what you have been doing for that, because they have been suffering for past 1 year, they're like, we don't know whom to reach out. We don't know whom to call. We don't know whom to speak. So still there are people who doesn't know that if they have any sprain in the hand, whom to reach out. They go to ortho gives some medicine or else some spray, like a little ointment, and they're coming back. They're like after that it's flaring up. So a lot of women, I would say, first of all, to start taking care of themselves, they don't know where to start it. They don't know whom to reach out. They don't know whom to talk to. That is one thing. And coming to balance, it's always one thing. I don't have time. Then when we ask, I have been doing the household chores, also I've been working, I've been going on with the things, it's going on, the meetings will go on. So I don't have time for myself. So this is one thing which I felt like, people are too much into that. That thing keeps running in their mind that I don't have time. They never think of that one point, I can make time. So that's the thing which we want to tell people, don't keep thinking in the mind, I can't make time. Try, I will try making time. When you tell to yourself, at least maybe it will start with 15 minutes in a day, then 20 minutes. But I would say that, as Dr. Deepal was also saying, yes, physical activity is much more focused now. It's not like, okay, I'm going for walks every day. That's not what we are looking out for. We want them to start working on their, like, overall body strength, health, physical, emotional, and mental, because we know there are a lot of health issues that's arising now, mainly because of lifestyle, stress, sedentary. So this is what is happening. It's, I would say, not just the, like, women at a middle age, but yes, they are also suffering with a lot of perimenopause symptoms. And before it was like maybe like 2 years earlier, it was just 2 years before menopause you saw that those changes. But now it's even 10 years before the menopause only the perimenopause period starts for the women. There are women at 35 years who had their hysterectomy done. They will be having a lot of health issues, but they feel that okay, hysterectomy is done, it is done, so that's why because of surgery I'm having these issues. But they never understand that there's a solution for the issues. They can try it out because they don't want to step out, they don't want to waste their time, they want to do something else, maybe household chores rather than thinking of themselves. So on this Women's Day, that's what I feel like, women has to take time for themselves to start with a little time. Then once they see the positive effect, then they will push themselves to start working on it. It's like, overall health, mental, physical, as well as emotional, because women is the medicine to the society. If they are good, yes, everyone is good. So that's what we need to, push people on, that you have to start taking care of yourself. You need to keep running around. Yes, as Shutapa was also telling, it's the same thing. We need to work on everything. We need to balance. Balance is something which we need to work on. Once, see, that's where people lack, because they feel they try to raise, they feel that somewhere the balance is out, and then they just go ahead, they stop. Okay, fine, it's okay, I'll not do something for myself. So that they need to understand how to organize it and try it out. That's what is from my side. They should start working on balancing and their health.
Thank you so much, Swati, for such a wonderful insights. So now next is Aditi. Aditi is running a very interesting and women-oriented or women-focused startup. So Aditi, why don't you talk about your startup, your thoughts on women's health? You are not audible, Aditi.
I'm not audible.
Yeah, it's on and off. Now it's fine.
Okay, I'll take off my headphones. Hi, I'm Aditi. Thanks, Meghna, and really nice to be here. I'm the co-founder of Cranberry. We're a women's health startup, and we work on women's chronic pain symptoms. So I think symptoms like what a lot of you are talking about. We are starting with PMS, so all the mood symptoms we have before our periods, and we work also on period cramps, urinary incontinence, migraines. So I think a lot of the things which limit our life as women. But yeah, as a doctor said, right now there are solutions for it, and so we try to make that super accessible for women, especially busy women. I think all this is super fascinating in terms of time and balance, because being a startup founder, I am like all the questions, like Meghna said, oh, we are overworked and everything. And I was like, this is all sounds like me. So I think I am guilty of the same. So don't want to preach here in a way, but overall, so I have done my PhD in behavioral economics and public health. So I think there, like, an important concept is like motivation and intrinsic and extrinsic motivation. So intrinsic meaning that, from inside we really should want to do something, and preventive health is unfortunately one of those things where as humans we don't see the benefit in it. uh, but I think like sessions like these and so many other activities, thanks to social media, which are changing now, is that as women we are maybe getting convinced that this is so important. And frankly, for generations this was never spoken about. So I am optimistic that that is making a change. We see with the especially younger women that, and actually even my mother, who's 75, that you are intrinsically motivated that I have to be strong, and then nothing beats that, and then you find that 10 minute in your day to do some functional exercise. So yeah, and then otherwise for the extrinsic motivation, I think everyone has to do a lot of hacks, especially women, given they are so busy, I feel. And yeah, I hopefully we'll discuss more about that. So I think more actionable.
Right. Thank you so much, Aditi. So let's start the first question, which I was just kind of asking people about what is the biggest challenge that you face. So this was a small poll that I took, and everybody rooted on work-life balance and the mental stress that work-life balance brings. I would say the pressure that work-life balance brings on women. So let's talk about it. What do you feel is the key challenge that women face when it comes to balance. As Sutapa rightly said, like, we are innately conditioned to take care of the family, at the same time work becomes a secondary thing. Now the women who choose to work always have that guilt inside her that she has left the family behind and she is taking care of her ambition. And that self guilt adds up as an emotional pressure to her sometimes when the things might not go the way they are going, especially when you are running your own startup or when you are having some major roles and responsibilities. Those imbalanced situations definitely come. So I would just love to know from your perspective what you guys do to overcome it, and is there any other challenge that you have faced or experienced and how you overcame? Anyone can take over first.
Yeah, I can speak to that. Um, it's always a balancing act. I think obviously technology is helping immensely. Today, the good part, there is always the silver lining to every major episode in our lives, and I think the pandemic, while it created so much of upheaval, brought on this whole culture of virtual sessions, virtual meetings, and I think that benefits women a lot. Of course, it's benefiting men as well and others, but we're definitely, if we use technology, we are saving time on various counts, time which can be utilized towards other things. um, you're absolutely right, Meghna, when you said, and what Dr. Swati and Dr. Deepal also said, and Aditi as well, is that we as women have so many priorities that the moment we start putting work on, like, our professional lives on top of that priority list, our health is the one that is sacrificed the most, right? So taking out that half an hour, 1 hour to do yoga, workout, meditation, any of them, or even just strength building exercises, we just that's the first thing that goes out of the window. But it's so essential for us to have that, because it is, again, it should be part of our routine. How I have uh, gone through this is very simple. I have conditioned my mind, it's the same thing, to you will always feel guilty, right? Like, I have a sense of guilt because I'm in Bangalore, my mother is in Calcutta, and she's got all kinds of age related ailments, right? But most of them are to do with the fact that she was not active during her younger years. And I can see it with my own eyes that when you're just simply not active, physically active, what it can do to you when you're 73, 74. But that guilt of a parent who is not always, in the best of health, and you're not there, that guilt is, it weighs on the mind, especially if you're a business owner and you have multiple things to do. So sometimes you just tell yourself that you're doing the best that you can. Accepting that you're doing the best that you can and telling yourself that you're doing the best that you can, I think, is the biggest thing that we have to do as women. Mentally condition ourselves that, hey, you're doing enough. So obviously, if you have a supportive family, you have spouses and partners and friends, they will also be telling you the same thing. But it's not always guaranteed. Support is not always guaranteed. Emotional support is not always guaranteed. Financial support is not always guaranteed. So you have to support yourself. You have to tell yourself that, I deserve to do this. I have the right to do this. I want to do this. These words, we don't channel it into the female psyche enough. Want, rights, demand. We are always, as I was saying earlier, and I wrote in my column today, we are always conditioned to put ourselves second to everything else that is happening around us. And I'll tell you a small incident. A friend of mine just got back to the workforce, and it's a second chance, second career, and frankly, I've kind of pulled her into it. And I could see that the moment the going gets a little tough, because you've suddenly come out after 13 years of being at home, there is a balance at the household which has to be reworked, reshaped with the help of the kid, the spouse, the domestic staff, everybody involved. But the moment we see that there's a tough day, I can see that, I can perceive that thing in her that, I think I'll let this be, I'll go back home. So the whole challenge is you have to tell yourself, no, you deserve to be doing whatever it is that you want to do. You want to climb Everest base camp after having three children, two children, whatever, you do that as well. So keep saying, when I say work, I'm not putting that burden of work and profession on everyone, but rather the desire of what they want to do in life. So that mental conditioning, I think, helps with the balance. Technology helps. Maintaining a routine helps. So just like you wake up in the morning and make food or breakfast for your family, you wake up in the morning and that first 30 minutes is your meditation time or your time for yoga or something. That routine will help. You're forcing yourself to do things. So maintaining a routine, I think, really helps. So three things from my side.
Beautiful, very beautiful, Sudhapa. All right. So, yes, Deepal, over to you now. What do you do?
So, I take it as it comes. Like every day is a challenge. Sometimes when you wake up in the morning and then you come to know now the day starts and you don't know what is coming, So you have to be prepared in the morning itself after waking up, that be ready. Challenges are on the way, whether it is related to work or home or kids or whatever. So I first prepare myself in the day, at the beginning of the day only, that be ready, not just physically but mentally. Whatever last moment changes in your schedule, whatever routine you have set. But basically, I'm a practicing physiotherapist since 20 years. I have my own clinic. I have a baby, and I take care of all the patients. Along with that, I do cancer rehab. That is the main area of my work. So I come across cancer patients every day, especially females with breast cancer. So what I see is I definitely give priority to my patients, that I make sure that I give my best treatment to them on time and as per their requirement, because it is different for cancer patients than the routine patients. So for a woman, I think they are always multitasking. So whenever a challenge comes, some time changes or whatever related to home or work, so I give myself a minute to think that what is my priority right now, so that I get clarity where to focus. I cannot be, definitely have to do multitasking, but it gives stress sometimes. So prioritize what at present moment, what is to be done, what is the best I can do, whether it is work related or home related, and I give priority wise I select my actions, and then so I don't feel guilty at the end of the day, that when I was required at work I was at home, or when I was required at home I was at work. you know that clarity is required, then you don't feel guilty. And as I come across many cancer patients, because of suppression of your feeling, that is the main reason now the cancer is spreading a lot. Cancer cases have increased a lot because as a woman we don't give priority to ourselves, or we are suppressing our emotions. Whether it is even if we do something for ourselves, we feel guilty, right? Or we are not happy, we are angry, whatever emotions we have, we try to suppress them to match and keep everyone else happy. That is our goal all the time. So self love is also required. Give priority, give time to yourself for your well being. Then you can, if you take care of your health, you can give your best to others as well. So that is what clarity is required, and self love is required, as far as I think.
Very true, Deepal. All right. So, moving to Aditi, what do you do?
Uh, so I think the main thing I do differently, but I'm a big fan of routine.
Your audio is still low.
Oh, okay. Now is it better?
Now it's fine. Yeah.
Okay. Apart from routine, so I think one of the things I do is really just talk to the people involved. So I'm trying to be like super transparent, because I think, like, especially let's say with parents, you do feel guilt. And then I've realized, like, if I'm not able to take some action, like really small things, like it's going to be my father's 80th birthday, so big, but I can't do the organization because I am just so busy. But I really have put it on my brother and declared that on the group. And so, I mean, I have a feeling in the end I'll end up doing it, but I don't have guilt. Rather, I think I will be the winner in that situation, because in the end I might have done it. But so, at least, like, and even at work, like, so with my co-founder or colleagues, we discuss really openly where the boundaries are getting, like, crossed. And so I think that at least removes the, like, the emotional burden of it, because anyway all of the doing is also a lot. So I think that way guilt, I think, has definitely reduced for me, just by being super transparent with everyone and kind of not keeping it to myself. Yeah, so I think that's something I've been doing in the last couple of years.
That was pretty interesting. Okay, so Swati, you being advising about a lot of practices that helps women to manage her day-to-day lifestyle. What are the practices that you would like to tell, like share your favorite ones to all the audience are present here?
Yeah. So we're talking about the work-life balance also. Yes, that is what I feel is very important. Whether you are, see, yeah, women nowadays, like, most of them want to work, and few of them, they are like, I'm okay. I just want to manage with the kids at home. I don't want to push too much myself. But I would say, like, when they start thinking about that, they're just stopping themselves over there itself from taking care of, their own health. So that's what I keep telling. When you prioritize your health, we're not talking only about being physical health, as I was telling before, it's emotional and mental health as well. It's overall together is what we want people to focus. So that's what I suggest all my clients. The one thing is to start fixing up a time. So you can't say that, okay, 7 o'clock I'll fix and then I'll do every day the same time. Maybe different times suits them. So don't fix initially, and then slowly they can start seeing which time suits them the most, and then start working on their physical health. So nowadays, it's like in the moment we talk about the physical health, the one thing that goes is like, go to the gym, hit the gym, and start working out. But personally, what I felt is most of the women, they are not comfortable going to the gym because they see other people doing the heavy workouts and they're not doing, they're demotivating. They're getting demotivated and they don't want to go after a few days. That is one thing. The other thing is once they start working on their physical health, after a few days they give up. And why they do that? Because they started working out, seeing some Google. They just search in the Google without any guidance, without some fitness trainer will tell them, and they go ahead. So the difference they need to understand is when they just start up their workouts, it's not directly jump into some sessions. Because recently also I had a session where Zumba trainer comes to me and says, I have knee pain, what am I supposed to do? It's my profession, I have to take Zumba classes. So if you see, she is taking care of her career, but she's not working on herself. Even though she is having the pains and discomfort, she didn't start working on. Like that, there are so many people who have the discomfort, but they don't know whom to reach out, they don't come. So only one thing I wanted to tell everyone is you should understand to start with whom to go and meet any musculoskeletal pain or any discomfort or posture issues. They need to start checking on whom to reach out. Okay, there's a person called physiotherapist. It's still, there are people who doesn't even know that. I would say there are a lot of educated people who are still confused. They just go to ortho and they're done with it. They don't know later whom to go to. Okay, it's not reduced. No, what should I do? They again go to another ortho, but they don't reach out to the physiotherapist. That is still there. So they just go on suffering with the same musculoskeletal pain. And of course, they don't end up into any of the exercises because they are having a pain. They need to understand what they need to do when they have a pain, muscle pain, or a joint pain, and then start working on getting up the solution for that and start up with their regular fitness. And yeah, I'm a certified diet counselor as well. So that's what I always work on few things. Like, when it comes to, I don't suggest people to start working on their weight loss first. I just wanted to tell them, like, because the moment they see that, the weight has not changed within few days, they just want within a days. They don't see and they get demotivated again. So it's a proper counseling for them is required at the beginning. No, not the short term goals. I suggest only one thing. If you have only like, within a month, 1 month, this is my goal. If they keep that, that's unnecessarily stressing them. Already they have too many things. They're trying to balance it. They're trying to work out. In that workout, they're again putting the pressure on themselves. That should not be there. They should start working on to keep in one thing, by keeping one thing in the mind, that it is for their well-being. In the sense, it's not just for a short term, but for lifelong, until they are there. As like, Dr. Chitapa was telling, her parents are also having the pains because of inactivity levels. So that's what we want. So at that age, we just want ourselves to be independent. We don't want to depend on anyone. We want to do things by ourselves. For that, our activity starts from now. And other focus that I wanted to give over here is, if anyone has a teenage, daughters, one thing I wanted to tell, they need to start working on explaining them or taking them to a counselor who can help them understand what the changes they feel, and they need to get into the physical activity. That is very important, because we see a lot of changes that's happening even in the teenage girls also: PCOD, thyroid, diabetes, cardiac arrest, just name it. Everything, whatever happens in the elder age, it's the same thing, it's happening even in the youngsters because of the stress that they have. So the balance starts from there also. They have to balance their studies, they have to balance their health. Previously it was not there, but now, even for the working women, we always think, okay, there is the end of the day, I want everyone, all the women, to sleep. Okay, I have done something good for myself, and then sleep peacefully. That's what. So every day, do one thing. Either you're taking care of your health by making a proper diet, or you're working out on your exercises, not just walking, but proper exercises happen at 40 minutes, at least strength training at home under the guidance. That is one thing. And then you can go ahead and do your regular activities or the working. But which I would say, one thing is not to compromise on the health just because of the work or the family. Because if you are good, people around you are going to be good. That's and happy as well. That's what I wanted to tell from myself. Dr. Vigni, you're on mute.
I'm so sorry. So yeah, that was beautiful. So I'll move forward with a question that has come from one of our viewer, and she is mentioning, like, please talk about confused women. Why she doesn't take self decision about herself or children's life. I think here the question again comes from the conditioning standpoint. Any thoughts, like why women get stuck when it comes to decision making? All women rely on their partners or parents when it comes to critical decision making, and that also adds up to the stress when the situations are when the women have to make critical decisions for herself. I think you guys all are in leadership roles, and you would also have faced some situations where you have to take critical decisions and you have to own those decisions. That's where things become stressful. So, any points anyone would like to talk about?
Same thing. I mean, it's the conditioning. Like from our childhood, just think about finances, for example. I'm sure all of us here have much more understanding of financial matters. I know I had to teach myself that because I did not like numbers, but then, you consciously decide. But when you're growing up, and if you have a sibling who's a male sibling, it's always the male sibling who's getting those little, you know, responsibilities within the household. Go to the shop and buy this, or go here and do, you start making decisions independently far earlier as a man than as a woman. And again, this is not India bound, this is a very international thing. But then when we look at some households which have been led by a matriarch, so say a grandmother was, there have been very, again, few and far between, but those strong characters, if there are those strong ladies who are the head of the household for many years and they've been controlling, say, a large joint family, the resources, how the kitchen works, what happens, some of the women in that household would have been taking decisions, maybe home related only, but at least that independence, sense of independence comes. We have always been taught to second guess our decisions, कि पहले पापा से पूछ लो, भाई से पूछ लो, husband से पूछ लो, boyfriend से पूछ लो. That is our general thing. We doubt ourselves. All human beings doubt themselves, so that's not but the uniqueness of women's self doubt, The female self doubt is quite high. The only way to overcome it is to take decisions, fail if you have to fail, and just rise up, because many decisions will be wrong. Also, personally, I don't see anything wrong in seeking advice. Before I take any, so on a day to day basis, I will probably be taking 20, 40 decisions, which are very low level decisions, maybe at the workforce, like at the workplace, say yes to this, no to that, whatever. At the household, maybe 7, 8 decisions, again very small decisions. But there will be those big decisions which have repercussions, which change things for your business or for your children, or for your own lives. It is okay to seek advice. It's We don't have to be super women. We just have to be as normal as men are. If we want to take a financial decision, for example, I will speak to my financial advisor. I will speak to my CA. I'll speak to my accountant, and I will speak to my partner, and I'll be like, is this the right thing that I'm doing? If it is something which is team related, for example, there are challenges which one faces, and as a single founder, I do seek the advice of some of my female friends as well, who are either leading teams or have an understanding. So some people have good understanding. I think it's okay to ask for advice, but forget the procrastination, that self doubt and procrastination. Take a decision. If it doesn't work out, you'll learn from it, as have millions of people before us. So, but when it comes to children, that is not something that I'll let you all, because I don't have children. I think dharma is my child, my company is my child, and I dedicate my life to it. But so I will not get into that, because I think there would be others who would be better placed to speak on that. But for day-to-day decisions, business decisions, life's decisions, it's okay to seek advice. There's no problem. Google is the best advice. Sometimes you get some amazing advice from YouTube, from good thinkers, friends and family, um, experts. Like financial advice, I don't care what the gender is. I want financial advice from a certified person. मुझे पैसा नहीं डुबाना है, and we are seeing how the market is choppy. You want advice. So yeah.
Right. I think women, what I have seen in my experience as well, women carry baggage of decisions. They will always, and that's the pattern which I've observed. I might be wrong, but I've observed that when men take decision, they don't spend time in self-doubting that decision. They say, okay, decision once made is made, now make it right. Versus women spend a lot of time overthinking about that decision. Like, okay, did I do it wrong? Shall I back it off? Shall I do it again? Or shall I cancel it off? And that's the core difference that exists between men and women. And the only way women should all can overcome this is, as Sitapa also mentioned, is fail sometime. Failure is good sometimes, because failure teaches you to accept the wrong decisions. That okay, fine, it happened, it went wrong, right? Let's start it again. And that's the only way I personally believe that women can overcome that emotional baggage of keeping decisions as the source of stress. Any other thoughts anybody would like to kind of add up here?
Yes, so as both of you already told that even if it is it it does not turn out to be right, or something is wrong, then but we learn by experiences only. And the next thing is we should be taking responsibility. We most of the time, women, as far as I know, we run away from taking the responsibility of the outcome or consequences. If if personally I would like to share that I don't like to take advice. I most of the time I'm doing things on my own, right? I was used to be like that, but then I take full responsibility of my actions, you know so then it was okay. But currently, now I am also learning I should take help whenever required. I should not be hesitant about the help when I need. But again, ultimately, it is, if I'm doing, I should take responsibility. That is the point that is missing most of the time. That is why women are not ready to take decisions on their own. And again, when kids are concerned, we should definitely, it should be mutual, um, from both the parents. And women should always raise her point also. It should not be like always the father decides, but the mother should always have a voice.
Right. How about Swati? What do you think about this?
Yeah, so yes, so many inputs from everyone. I think I should also learn a lot because I'm also starting up one women wellness center over here along with my other women health physiotherapist. So it's like when we wanted to start up, like as Shita was telling, there should be a lot of family support also. I started it online, but yes, there was a support from my family. They wanted me to start it offline as well, especially in our area in Hyderabad. There is not much of awareness as it's in Bangalore. Because see, I was in Bangalore and then I was working when I got the feedback, when I feel that, women are actually feeling better after our treatment, that's your positive feedback and that's what motivates you to do it better and more and more. So after shifting here, yes, that's what there was a lack. I was still working, but it wasn't like, completely client dealing. So I started it up. That motivation, that positivity I start feeling when I see the people saying that, okay, this is what we need, this is what we were missing all this while. These are the people whom we want to meet and know a lot of things. Yeah, as you guys were saying, yes, we need a lot of advice also, we need to take advice. But sometimes, when it comes to, your own field, you know where to take the decision. It's, both the ways. See, I am completely clueless about like, how to start the business, the work and everything. So my work over here is like, me and my friend, we are both are working on how to make sure that, we reach out, it reaches out to the people. So, and they should also, and people should also know who we are because here no one knows there is someone called women health physiotherapist. They know only physiotherapist and they know only that physiotherapist will do a little bit of massage or they'll just apply some machines. They don't know really exactly what the physiotherapist does. Okay. So that's what we wanted people to know that first. So we are working on that. So where our partners are trying to work on like, how it goes on with the financial thing, marketing thing, how it goes. So we are not into that like that part. We are focusing on only one part. So that's what I feel like, when, yeah, as Shutapa was telling, it's also the support from the family. If you get it, yes, you will not have any back end thoughts. There is a push for you. Okay, whatever I'm doing it right. Even if there is a mistake, yes, I will learn from it. Definitely, I'll learn from it and I'll try to do it in the right way as it goes on. But I would say, whatever the decision we take, women takes, once you take the decision, you try working on it. That is what we feel like, try working on it. Maybe, yeah, there may be a failure or you may figure out a better way to do it. So it's just the learning in the process. That's what, but it's not that, you should stop it. When there's a mistake, you should just stop. Okay, it's better I stop it. I don't want to try it out. That should not be a halt for their journey. It's like, whether it is their workout or whether it is their physical health or their regular work or anything about working on the work life balance. They just need to go ahead, take the decisions, and then go ahead and keep working on a different ways.
Awesome. How about you, Aditi? How you deal with this?
Yeah, so I think the problem identification is totally right. One of my friends, interestingly, once said to me that she was really struggling to make decisions about her kid, and then she realized that she had never made decisions for herself in her life. So this is the conditioning point, and that was so like aha for me. I'm like, oh sure, you don't have a framework. How do you make a decision? So I think maybe two hacks. One is that maybe start with the ease, like the smaller decisions. What Shubha was saying, like don't go for where should I invest my money. That's scary for men, women, for Warren Buffett most probably. So just the smaller decisions, and then I am personally a fan of frameworks. And someone said like Google or YouTube, like there are like frameworks also. How do you like think about making decisions? I mean, pros and cons is very simple way, but I mean, and these days actually Chat GPT and all is amazing to bounce off. So I mean, so with those hacks, like even if you just start making small decisions, I think then you start building a intuition for it and gain confidence. And so yeah, I think that's the way that can be the resolution for next month. Two small decisions.
Beautiful, beautiful. Great. So let's move on to the next part. And this next part is towards exercise and fitness and well being. So I would like to know from all of you how you guys are finding time for yourself to keep yourself fit and healthy. Yeah, let's start with Aditi today. Right now, just like,
Uh, I think I do two things. One, I have a standing desk which I should have used. Now I'm realizing. So I do stand half of my working time now because I was just sitting so much. I think
Mhm.
it's getting unbearable. And then the other thing I do is that so in terms of like just functional exercise through the day, like I have a hula hoop behind the door. So basically if I figure I like doing something, I do it. And with exercise, I think overall in life that has been the hack for me, to just find the thing I like. And I think so that is the motivational thing for me. I think some people are motivated by numbers and doing like something else, but yeah, I think my hack, I mean hula hoop, I mean, and my core strength is really improving. So I that's what I do, I think.
Interesting. How about Swati? What you do, Swati?
Yeah, so I work out every day in the morning. So that is my personal workout, 45 minutes. And post that, I take online sessions, as I was telling. And while working on the online sessions, what I feel is like, first two repetitions, I see their posture and everything. Then they feel motivated when I do it. When I don't do it, and when they keep checking, they'll be like, okay, I'm done, I can't do it. After 10 repetitions, they just give up. Then when I do it, then they'll be like, okay, fine, I'll try push. So in that way, like, throughout the day, my workouts go on. So it's not like, I don't have to find specifically time for myself with the classes itself. So I take classes nowadays over here, even for the 12, 13 years, the girls also, they wanted, once that in their first menstrual cycle, they are trying to be like, dull. So they wanted me to take classes for them also. So taking the fun way for them. So mostly throughout the day, at least 3 to 4 hours of some or the other activities will happen. And personally, I don't like to depend on anyone else. It's like I don't want to ask help. It's not, see, what I tell everyone is like, don't hesitate to ask help. Don't feel that asking help is selfish. But it's for my side, it's not about selfish. I just don't like. It's like I like to do everything at home by myself, taking care of my kid, studies, myself, my work, everything. I just like to be on toes throughout the day. I feel if I sit for longer time at a stretch, I can't sit. Even now, sitting for longer time at a stretch is difficult for me. I can't sit for more than 5 minutes. Wherever I go, I just try to move around, walk around. So that's all. So it's like for me, I don't have to specifically find the time for exercises. I am active. I keep working on. But yeah, one thing what I feel when I started like proper workouts, Pilates and all that, I take care of the mat Pilates as well. So once I started working on like regularly on the mat Pilates, whatever the activity I do at home, like maybe bending, taking the things up, I automatically squeeze my core muscles or glute muscles or thigh muscles. It's not that I'm stressing any one particular muscle. So I go with the squats. It's automatically. It's not that consciously I'm taking that position. So I feel like once you start working on, then that is something which automatically gets into your system. You will be able to do it easily. So even if I just give 1 day, 2 day gap in between the workouts, but that 1 or 2 days also, it's not that I be taking rest, but I do the other activities, other things and all that. And personally, I love dancing. So it's like music is my motivation. The moment you put on music, 1 hour, 2 hours, it goes on. I'll not even figure out like, oh, it's 1 hour. No, it just goes on. People will be like, it's already 1 hour. Stop now. So it's like that. I love music. So like Dr. Aditi was saying, like she likes to do whatever motivates her. That is my motivation, music. So I like to go ahead with that one.
Beautiful. I think that's one advantage of being into this physiotherapy, health, fitness space. Like you don't have to find time to stay active. You get to do it, right? I think Sutapa would be kind of. You need to be more mindful about finding that time and do that because your work involves a lot of long setting hours and spending time in front of screen. So yeah, over to you, Sutapa. What do you do for managing your fitness routines?
Meghna, of course, knows a bit about all the various sitting issues that we've had. She's done a couple of sessions with our team as well, or all laptop related problems. Um, I actually love working out. I love pushing, lifting weights. I think it's been what, 20 odd years, maybe longer. But but I did not enjoy going to the gym. For me, going to the gym is a chore. I don't have that time. Kapre badlo, take a cab, go to the gym, come back, or even your colony gym. So, in the last few years, the best thing I have done for myself is I've set up something at home. So I have a smart gym. It's again by a startup, Bangalore-based startup. Most of them are in Bangalore, called Aroleap. It's like, it's a smart machine. It's like the US Tonal, that brand. So they have it here, and I was one of their first customers, and I knew it because for me, I can do a working lunch. My lunches are always working because I'm doing something and grabbing a quick bite. So that 45 minutes that people would usually sit down and have, which I know I should do, but on a crunch day, I will use that to do a quick workout if I can. So I do enjoy my workouts a lot. But having said that, with long hours in front of the computer, post COVID, there are issues that one has started developing, like a very bad cervical. So these are things for which I'm now more conscious, and I do things to strengthen my neck. Some amount of chronic pain has set in. I will not deny that, and I definitely want to try hula hoop now that Aditi said, and I think that's fun because sometimes we just need that fun. So the moment she said that, I was like, oh yeah, I didn't, I want to try that, and it's also at home. So anything which is at home, and I get what Swati is saying, that if you can do it at home, it's you save so much time, right? I mean that whole but for me, I enjoy working out. When I don't work out, I feel that a part of me has, like, in the day something's not gone right, because a lot of my frustration I feel of life comes out when I lift weights or if I do some kickboxing. I like it, it really calms me down. So I enjoy my workouts. I do.
Awesome, awesome. What about Deepal? What you do for keeping yourself active?
Yeah, so as a physiotherapist, we have to be active all the time, as you both mentioned. But personally, I also don't like to go to the gym. And again, when I'm showing the patients some of the exercises, I do it along with them. So automatically that workout is taken care of. But also along with that, I like swimming, and I like all kind of sports activities. And again, my son is now 7 years old. So what I do is we both go for swimming together, and we play badminton together at least 3 to 4 times in a week. So automatically, the mother son bonding time is also there, and along with that, I also do. So when he watches that mama is doing, he also loves doing all these physical activities. He is very physical, so we both enjoy swimming and playing badminton. So he's always excited, and it pushes me as well. If I'm like, sometimes I don't want to go today, or let's not do today. No, mama, let's go. So it's a big motivation for me, and I also enjoy. So for me, that is the workout. That I enjoy also. So it does not seem like I'm doing any kind of workout.
Pretty interesting. I have an interesting take on this. What I do, as Swati also told, like and I think majority of women are designed that way. They like to take things up on themselves and do it everything their way, and they want to do it by themselves. So I am someone who also like to take care of household stuff in my way, and somewhere I've integrated those workouts. Like when the day when I'm not able to, I love walking, I love running, that's my high. But the days when I'm not able to do it, what I do is the household chores that we do, like maybe when you are kind of doing your vacuum, instead of vacuum we just take our broom and just do a deep squat and then just clean out the rooms. It sounds very weird, but that's a very strong core exercise. It not only strengthens your pelvic floor muscles, but it's a very deep good exercise for your entire back. And I feel yeah, that is also the reason why our ancestors were so healthy. They never had the kind of issues that we had, because every single day they used to mop the floors, they used to clean the floor, deep squatting. We have somewhere forgotten deep squats, right? So and I try to find out ways throughout the day where I can just do deep squatting in any possible way. Maybe if I have to pick up an object which has fallen down, I'll do a deep squat, I'll pick it up and keep it back again. Or if things have fallen down, or if I just have to take out a box and just keep it somewhere else, let's do that. So that's a very simple quick hack, but it's such a practical way for any women. It will not only help in improving the core strength, but it will definitely strengthen the pelvic floor muscles, which usually gets weak over a period of years or time, right? So yeah, just a quick thing that I wanted to share. So yeah, guys, so this was something which we spoke about fitness. Now just one last, because we are short of time. uh, what is that one thing that you all, as busy professionals, someone, we are very privileged, I believe, compared to a lot of women who are still not able to find out the time for themselves, or are struggling to manage work life balance and decision making. What is that one message that you all would like to give to a women watching this live stream right now, thinking that, okay, what if I can take one thing from you and implement in my life so that I can make my life better? Anyone can take over and share your message.
So I would like to say that love your body so that you take care of it.
Right. Love yourself. Self love is the most important. Once you love yourself, automatically you will be able to love the people around you. Right. Yeah. Anyone else who would like to go ahead now?
Ditch the guilt. You are important. I love the fact that people kept it so short, so I don't want to ditch the guilt. You are important.
Beautiful. How about Swati? What is your message to everyone?
Don't sit with the problem behind, just start working on and, don't take the step back.
How about Aditi?
I'll be like, seek solutions and help.
Beautiful. Thank you so much, guys. We are a bit short of time. That's why I have to kind of quick, close this here. But I had a lot of question. I learned a lot from all of you guys. A lot of hacks. I think we women should have these kind of conversations often, so that we can just at least share our thoughts, ideas. Loved the idea what Deepal did for the swimming. Maybe I can also implement that with my daughter, so that I'll also get some more me time with her. Also, Sitapa's point of view of taking decisions, financial decisions, very proactively, to like Aditi's point of view, to Swati's way of approach. Everything was so beautiful. Thank you, guys. Thank you so much for joining this session on such a short notice. I hope you enjoyed as well. And we believe that we will be trying to do more such sessions in future as well. So thank you. Thank you so much.
Thank you for having us and great to meet
Thank you.
everybody
Thank
as
you.
well. Happy Women's Day
Same
to
here.
all.
Happy
Happy
Wednesday.
Women's Day.
Thank you. Wish you all happy Women's Day. Bye.
Good
Bye.
day.
All right, guys. So now it's time to move to our second part of the second session, which is the product pop up. And the product that we are going to talk about today is Respire. This is a game changer device for anyone who wants to take their health in their own hand. And to talk about this product, I'm going to invite Mr. Ankur Jaiswal, who is the founder of Respire, so that he can talk more about this product. So thank you so much, Ankur, for joining today's session. Uh, it's a very unique opportunity, I would say, or it's a unique day, because we are trying to focus more on women and helping women to take proactive steps towards their own health. And I genuinely believe your product Respire can help women across not only India, outside India as well, to take that first step of preventive care in their own hands. So over to you, Ankur, if you can talk a bit more about Respire. If you want me to kind of open up, show whatever it is, we feel free to just let me know, so that the audience can watch it and learn more about this. Over to
Sure.
you.
Thank you, Meghna. First of all, happy Women's Day, and thank you for a nice introduction. So, I just want to add like the Respire is basically a tool we designed especially for the preventive healthcare point of view, because we as understand like especially if I talk about like tier 1 tier 2 city, we have very busy life, very hectic life, where we don't spare too much time on our health side, and that's the major problem. Like the most of the people right now having a poor lifestyle, that's a major problem most of the person have. And there is a major thing like slowly these are all lifestyle diseases started increasing in our body due to our poor lifestyle. So that is a major core problem which we are actually find out, and we trying to solve with this product Respire. So we started in September 21. We formed the company in September 21, and at that time we was clear like we need to focus on preventive healthcare side, and the what is the easiest way which can be user can use, and user can usually understand his body and his lifestyle, and what is the convenient way. So we choose the breath. Like from like breath is a key role of our body, which actually talk a lot about our body, like because breath is actually coming from our metabolism pathway. So it's lots of hidden information in our body. So that's the reason we choose the technology breath, and based on that technology we created Respire. So basically I simply give you the brief idea about Respire, what exactly Respire do and what exactly is the problem we are solving. So if I talk about the age of 20s to 50s, like the young age where we think we are healthy and fit, and as I told you, in the tier 1, tier 2 city, we generally spend a very busy lifestyle. And that's the reason like the poor lifestyle is a major cause of all lifestyle disease, which actually affecting our body in a very early stage. And as a layman, we don't understand those small changes in our body, like physical changes in our body. Once we got the proper symptoms, at that time only we go to the hospital, and 90% time we diagnose with the disease. And that those diseases specifically, I'm saying the lifestyle disease like diabetic issue, liver issue, respiratory issue. This is a common disease generally most of the humans have right now. So that's a major gap actually we are trying to solve, because you actually missed out that 6 month to 1 year time where you can understand your body, understand your lifestyle, you can manage your health and manage your lifestyle also, and easily reverse the disease. So that particular time you missed out. So that's the reason to resolve this problem we created Respire. Respire is first of all is a patented device, and it's a Class B medical device which is approved by CDSCO, and we did the clinical study with the help of multiple aims, and that's how we created Respire. So basically, as I told you, Respire working on the breath technology, where simply user have to exhale his breath into a Respire device and then capture their breath biomarker, and based on that we provide the 4 clinical score, and those clinical scores like sugar score, your liver score, your respiratory score, and your gut health. This 4 score basically we provided from your breath, and which is talk about your clinical health or the health your or you can say your body organ level health. The most important part, we ask the user before the testing to provide his last 24-hour lifestyle data. Lifestyle data, it means like the what type of exercise they did, what is the sleep cycle, what is the water intake, what is the food intake, and based on that we provide the nutrition score and the activity score. So now whenever user use the device, they can get the 6 score. And the most important part, now we are providing the complete detail. So as we already know about his lifestyle, so we provide the complete detail about his lifestyle, like what is the food consumption, like what is the nutrition part, and whatever the exercise or sleep pattern is up to the mark or not. And second part is like whatever the health score they got, like sugar score, liver score, gut score, and respiratory score. And now we are correlating all this 4 score with his lifestyle, and we are saying in last 24 hour what mistake you did. Suppose his score is not good, why it is not good, what is the reason behind it, the complete detailing we provide. Now the most important part, we also provide the complete suggestion. Now, like we already show you the problem, we already show you the health score. Now what need to be changed in my lifestyle, what need to be improved? So all suggestion we provide based on your body type, based on your, which is completely personalized, and it is based on your body type, especially focus on the food, like what type of food is good for you, what type of exercise is good for you, and what type of sleep pattern or water pattern is good for you. Now the most important part, this device is not only used by the single person, it's a family device, as we believe in family value and family system. So that's the reason we designed the Respire in that way, like the one single device can be used by 4 person. So it's a complete package for the family who can track their health, and it's a DIY tool which is do it in herself in your home itself. You can track your health, you can track your body, you can track your lifestyle, and based on that whatever the changes needed in your lifestyle you need to change. Suppose after the changing a lifestyle, still the scores are not improving at least for 15 days, then automatically we provide the pop-up like go and once visit the hospital or visit the doctor. So that is what we are actually created. And if I talk about the Respire journey, so as I told you, we started in the September 21, and we already supported by Department of Science and Technology, Startup India Seed Fund. We also incubated by IIT Patna. We have clinical partners like AIMS Patna, AIMS Devgarh, JSS Mysore, and 10 more hospitals where we conduct the clinical study, where we onboarded more than 4,000 plus patient and did the correlation with the blood analysis and got the accuracy of 90%. If I talk about the credibility and certification, so definitely Respire clear all certification. Our company is ISO 13485 certified. We already have Class B medical device certification from CDSCO MD5 license. We also have lab safety certification, test license and sales license. So all certification, whatever the compliances needed, we already clear those all compliances, and we are really happy to improve the health quality of the users and all. So that is from my side. Meghna, if you have any question or you can ask me or any, and you want to add anything, you can just let me know.
Yes. So, guys, I would like to take this opportunity today to unbox this and showcase everyone this product. The reason why I have partnered with Whisper and I am trying to focus more on talking more about this is because I think that this is the need of an hour. We all are at a very high risk of developing lifestyle issues right now. And the best part that we can do for not only for ourselves but our families is to make sure that we take those preventive steps in our own hand. But the problem is that whenever we try to think about diagnosis or else finding out the chances of what is the likelihood of me developing a health issue, then the diagnostic tests are either very expensive or else they are painful. You have to go for a blood prick test, you have to remove your blood, send it for the test. It's not something which is very instant. And what one thing that I liked about Respire was that the the findings that you get gives you an instant understanding about your health parameters. So I would like to take this opportunity of Women's Health Day to unbox this device for the first time in front of you. So this is the packaging of Respire device. As you can see, it's a very simple, sleek device. Now, when I open this device, we come or we get this kind of box. And in this box, this is the most simplest and the most lightweight tool that you will need to do your health analysis, right? All you need to do is just take out this part and you get this kind of mouthpieces. 1 minute, let me show you guys like this. We need to insert this in this way. Then this is the wire that we have to attach and attach it to the phone that you have got. When you attach this to your phone, what will happen is there is an app that you need to download, and your app will take some important data about you. It will also ask you some interesting questions that are very critical for the app to analyze about your lifestyle. This would be the food, the kind of food that you eat, the water intake that you had, what is the amount of physical activity that you did. Even the app asks you what exactly you ate a day before, which will help the app to understand the number of calories that you have taken. Once that input is done, you need to exhale your breath from this device. And just with the help of this exhale, the device will do your breathwork analysis. When the breathwork analysis is done, as Ankur mentioned, the four scores, the most important scores that are there, that the app will get and let you know. That will be your sugar level, that will be your gut score, that will be Ankur. Can you just kind of talk here more
Yeah.
about what? Yeah.
So the four scores like the gut score, your sugar score, your respiratory score, and your liver score. So this four score basically majorly we are capturing from your breath. And as you mentioned, the before the testing, we ask the user to provide the data in terms of the lifestyle. So based on that, we provide the two more score, which is nutrition score and the activity score.
Right. Now, when these four scores are taken, what will happen is you need to do this on a regular basis, on a daily basis. When you do this on a daily basis, the app analyzes this data and gives you patterns on where you need to make your lifestyle changes, where you need to work more on. Let me give you some examples. Let's say if your sugar score is coming constantly altered or is not under normal limits, at that time the app will definitely recommend you the dietary modifications that you need to do, at the same time the physical activities that you need to do. If your gut score is not coming normal, then again there has to be diet modification that needs to be done, and that diet modification will also be recommended to you through this app. And the most beautiful part or most unique part about this app is that when you buy this device you get 4 user access along with this 4 mouthpieces. What does that mean? You can test with this one device for your entire family. So you are taking care of your own health. At the same time, you're also taking care of the health of your parents and your spouse. So four people can actually test this test their health through this one single lightweight, simple and sleek device. This device is, as Ankur also mentioned, it's FDA approved and has got 90% accuracy. And that's why you can rely on this to get an overall picture about your health and well being. Now, how you can benefit using this device? We have some offers that we have recently launched to help you guys to experience this product at first hand, at the same time, use and give support to this. So we are keeping this product live on our channel for the first time, and we are giving this particular product at a very special price for people who will be watching this video and reaching out to us to purchase the product. You will be getting this product flat at rupees 5999. Whereas if you see the MRP, the MRP of this product is very high. So yes, it is 14,999, but this is a one-time offer that you are getting to buy this product just at rupees 599 if you are viewer of this particular live stream, or else if you have joined our community. After watching this, all you need to do, if you can see in our chat box, we have shared our phone number. Please take that down. I will put it again here. I will just pin the phone number. Okay, I'll put it here again. Right. All you need to do is place a phone call. And if you want any further inquiries, any further information about this product, you can just call us and ask us. And if you want further details, if you feel that, no, I want to know more about this product, you can definitely visit Respire's website. Ankur, can you just help me typing the Respire's website?
Yeah, just a second. I'm typing in the chat. Yeah, just now I message.
You can just visit healthqrehab.com and just request a call back. We will reach out to you and help you to get more information about this product. I'm just putting a new. Okay, so we have a new referral link as well for you now. Just sharing that. So with this left referral link, if you buy, you will get the discounted price that I just mentioned to you right now. So what are you waiting, guys? Take help of this particular device, Respire, to take care of your own health and take care of your loved ones. Thank you so much for watching this pop up, and I'll see you in the next session. Thank you so
Thank
much,
you.
Ankur, for joining. It was great to have you and looking forward to see how this Respire grows and
Sure.
help millions of people. Thank
Sure.
you.
Thank you. Thank you for the day. Thank you. Take care. Bye.
Yeah, bye. All right, guys. So now it's time for a quick break, and we will be joining again sharp at 11:30, where we have another pop-up lined up for you for your pain management. Looking forward. All right. So, welcome back, everyone. So, thank you so much for being there and joining us for this Women's Day event. So, right now, our product pop up session is going on, and we have some brands lined up with us with whom we are associated with. And we genuinely believe that these products should help millions of people. And that's why this entire session is planned for. And with me today is Mr. Danish, who is the founder of Cure by Design. Cure by Design is a unique brand that is trying to solve pain management, at the same time other health and wellness related issues through a very unique concept of CBD. So I want Tanish to talk more about the products. At the same time, let people know what exactly is CBD, how different it is, and what is the current scenario in India in terms of the legal aspects of it. So thank you so much, Danish, for joining today's session, and over to you.
Yeah, thank you, Meghna, for having me. And good morning to everyone, and a very happy Women's Day. It's an absolute privilege to be here today, celebrating the strength, resilience, and well being of women. So, as we honor the incredible contributions of women across all walks of life, we're here to talk about things that are often overlooked, which is their health and their wellness. So, before we deep dive into Cure by Design, again, I would like to acknowledge something, which is the sacrifices and dedications of women all stages of life, whether it's balancing their careers, managing households, raising children, uh, you know, and navigating through life. Uh, women are the backbones of families and society. So today, I'm, I'm happy to be a part of the celebration of women via Health Q Rehab. And we're going to explore, the role of Vijaya, which is the Ayurvedic word for cannabis or bhang, which is completely legalized now, and how it helps women, especially in pain management, hormonal imbalances, mental wellness, sleep, and overall healing. So thank you again, HealthQ Rehab and Meghna for organizing this. So at Cure by Design, we are primarily a hemp and CBD based company where we are where we are actually bridging the gap between Ayurveda and modern science. Uh, so we have a wide range of products from oral products to topical application. CBD. So the science of how CBD works is, we have an endocannabinoid system, which is like your cardiovascular system, your muscular system, your nervous system. There is a very intricate system in our body called the endocannabinoid system, and this is what regulates or helps regulate homeostasis in the body. So homeostasis is when all your hormones are balanced. Especially for women, this is very critical, right? Once your hormones are balanced, you're able to think better and also be more active. So generally, women are prone to more chronic pain, stress, autoimmune conditions, and hormonal fluctuations. And instead of relying on general painkillers, sedatives, and hormone therapy, CBD or Vijaya is a plant-based solution and can help regulate homeostasis and help bring this balance in your day-to-day life. Um, so coming back to the endocannabinoid system, this is linked to almost all vital organs in your body. Your heart, your lungs, your kidney, your liver, your muscles, and your nerves. So, which is why CBD works wonderfully for immediate pain relief topically, and orally it helps create this balance through the CB1 and CB2 receptors in the body. So, in India, we have the full spectrum, which is not just the CBD, we have minor cannabinoids, the THC, and all of this. And there is a theory around this. It's called the entourage effect, where you need the full spectrum, like compared to the US and other countries where CBD is legal. I'm sorry if I'm going a little too deep, but it's kind of important for us to know the benefit that the Indian Vijaya or the CBD has over what you get across the world. So here we're using the Indian land race, and we have a standardization method, and this basically helps. We have different ratios, one which is CBD dominant for mental health, and one which is THC dominant for chronic pain. This can even help women during their cycle. We have a painkiller or a pain tablet, which can be a substitute to your traditional painkillers during the cycle, like Meftal or any other painkiller. And this can be used without any long-term or short-term side effects. This does not build any resistance in the body, although this might take maybe half an hour to feel compared to a traditional painkiller, which takes about 10 to 15 minutes. So our products are available in tinctures, in capsules, and due to the regulatory framework in India, all of our products have to be given with a prescription. So we do an additional step where we do a free consultation for all the patients opting for CBD. One is the legality, of course, and the second is to just make sure that because this is a very new concept, we make sure that there is proper hand holding, and the patient also gets the right dosage that is required. Because if you take less, then it won't be effective, and too much can make the patient a little bit drowsy and lethargic. And again, this is only short term. There are no long term side effects. We also have a massage oil that works really well. This can be used in physiotherapy sessions. In fact, we have partnered with quite a few physiotherapists. They use it in their sessions and also prescribe it. Because CBD, like I mentioned, we have CB1 and CB2 receptors on our skin. CBD is something that actually gets absorbed into the muscles and the nerves and works almost immediately for pain management and pain relief. Um, just to add to a few points about Cure by Design, we're 100% Ayush certified. All of our products are, of course, 100% natural and Ayurvedic. And the idea is we started off with CBD products, but as we started interacting with our patients, and we realized that CBD helps, but symptomatically, but there is more relief that is needed. So now we've also launched a range of Ayurvedic products and functional mushrooms that complement the treatment, whether it be for anxiety, mental health, sleep, or pain management. These are the three main criteria that we treat: mental health, sleep conditions, and pain management. So that's about it, Meghna. If there's any questions? I think it's on mute.
Yeah, so sorry. So I just wanted you to kind of speak more about these products. So I have some of the packaging with me. So if you can just elaborate a bit more about these so that people can get a more fair idea. So what
Yes.
is this one, which is says it's a muscle, joint, and neuropathic pain relief, full spectrum Vijaya leaf extract massage oil. It's a pain aid. This is
Yes.
also the same, but I
Yes.
think this is a smaller version and this is the bigger version, and I think this is a roll-on one, and this is like a straight application. So what
Yeah.
difference does this make?
Absolutely. So that is actually one of our best sellers because when it comes to CBD, which is very new in India, most of the time people would ideally try something topically, see how that works, and then progress to something oral. So for physiotherapy also, like I was mentioning, that CBD gets absorbed into the muscles and the nerves. This is a Ayurvedic blend where apart from CBD, we've used eucalyptus, chamomile, shatavari, other herbs that work for pain management. All of our products have been formulated alongside Ayurvedic doctors, and to make sure there is some level of efficacy uh, and effect of the product. So this is one of our best sellers, and it works almost within 10 to 15 minutes. The roll-on is a convenient, travel-friendly option for people who have constant pain, nerve pain. It can also be used for migraines, during your cycle, period pain, bloating, and stuff. Uh, and yeah, so generally people opt for topical first, and once that works, then that confidence also builds up, and they move to something oral, and
Awesome.
that's like the breaking the ice kind of product.
Great, great. So I was also going through all the series of products that you've got. So there's something also called a CBD patch. If you can talk a bit more about that.
So absolutely. Uh, so while this product and the patch both are for pain management, the product, uh, I mean, the reason is the same for pain, chronic pain, mild to chronic pain, and they both are effective for about 6 to 8 hours. But the patch is more travel friendly. Maybe you're traveling, you're out for a meeting, you woke up with a little neck pain, uh, tummy pain. Instead of using a massage oil, or it's under your shirt or in the back where you can't really use something oily, then the patch is a very convenient, travel friendly, and it's convenient to use. For
All
again
right.
pain management, topically CBD works. It's very localized. It works at that particular area. It doesn't really spread, unlike your say a mephtal patch. I mean, and all these other patches that gabapentanol and all, which actually spreads. This is more localized,
Mhm.
and for it helps almost immediately for pain management.
All right. So if anyone has to use any of these products, can they buy directly or they need a recommendation or say prescription from an Ayurveda practitioner, then only they can buy it?
Sure. So all of the topical products are OTC, over the counter, where you don't need a prescription. But the oral products, legally you do need a prescription. So we have a range of doctors also on board, doctors who are open to this kind of medication, who have experience using this kind of medication. Uh, so we do a free consultation for day-to-day ailments, but we also have, for oncology we have a specialist. For mental health we have a specialist. But these are all free. These are not free. These are paid consultations.
Mhm.
Uh, but just initially, for a little bit hand holding, somebody's new. Like I said, dosage also is key, because if you take less, then probably you'll say CBD doesn't work for me, and give up. And if you take too much, also it can have, not a side effect, but it can make you little drowsy, lethargic for 6 to 8 hours. And person to person, that can also uh, put you off and not uh, want you to use it further. So which is why, to make sure the patient also gets the right, and the most out of this medication, we do a free consultation.
Perfect, beautiful. And if anybody have to kind of check out these ranges, where they should go, where they can buy these products from, if you can just give a bit more about info about
Sure,
that.
sure. So, in this space, I would like to believe that we were the first few companies in the medical cannabis and hemp space. So, we have a website where we ship across India, and very recently we've opened a little store slash experience center in the heart of Bangalore in Indranagar. Just for people, again, this builds a little bit of confidence. There are a lot of people who want to come meet the doctor, sit down, understand the products, because of the stigma around this particular product, and taboo, which we are kind of fighting also. Because globally, there are patients who've, from cancer to pain to mood, they found relief. Being an Indian origin plant, we are still navigating this whole regulatory thing. So, apart from, I think Cure by Design is also focusing on trying to, free this plant, and build as much education and awareness also.
Awesome, perfect, awesome, Danish. Thank you so much for joining and sharing
Thank
the
you.
insights and a lot of information about this. Guys, we will be mentioning the link of Cure by Design in the chat box. So you can directly go ahead and check them out. And if you want any help in understanding this product, or if you want to know more about this product, you can also reach out to us and we will directly connect you to Danish, who will be able to help you out. Don't forget to visit the Experience Center at Indranagar and check out these products by yourself, so that you can work on your own pain relief. Thank you so much, Danish, for joining. And I hope
Thank thank
this
you so much.
attempt which helped you to kind of raise more awareness about CBD.
It was a
Yeah.
pleasure. Thank you for having us, and happy Women's Day again to everybody tuned in.
Thank you. Thank you so much.
Thank you.
All right, guys. So now the next session is by our nutritionist who would be talking about hormonal health and how to take care of it. But before that, we will be taking a small and quick 5 minutes break. So we will be back again in 5 minutes with a very interesting discussion on nutrition. So stay tuned. All right, friends. So we had our quick 5 minutes break. And before we start our next session, which is about hormones and how women can take care of her hormone in this changing time, we are going to have a quick warm up session, a exercise session, because we had so much of discussion about exercise. Today's session is all about exercise and musculoskeletal health and well-being. Then why not to do some exercises, right? So let's just spend some time in doing a quick workout. I don't think it's a workout, but it's a warm-up exercise that anyone can do so that they can take care of their own health. Let's get started. What I want you to do is I want you to place one hand on your chest, close your eyes, observe your breathing, observe, breathe in, breathe out. Observe your breath, breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. In, out. In, out. In, out. In, out. In, out. In, and relax. Great. So, so sorry for my cough. My throat is a bit disturbed. It has got infection. That's why those coughs are coming. Okay. So now the next exercise, what we are going to do is neck movements. So what you need to do is simple neck bending and then look up. Do it with me. Come on. Bend down and look up. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. Okay, so this was simple neck movement. Make sure to do it in a pain-free range. The next exercise, what we are going to do is simple neck rotations, where you're going to rotate your neck side to side. Turn your neck 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. Now the next neck movement will be side bends. So we are going to bend the neck on the side this way. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. All right. Now it's time to move some shoulders. Shoulder blade exercises. So what you need to do is lift up your shoulders and then bring down. Let's do this for 10 repetitions. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now rotate your shoulders. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Anti-clockwise. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. All right. After that, we're going to keep our hands in this way. Bring the hands back and then front. Let's do this for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. and relax. Now we are going to keep our hands up and down like this. One, two, three, four, five, six, seven, 8, 9, 10. Why we are doing this exercise? Do you know? Because we want the shoulder movements in every range to happen. Now, shoulder is not just about hands up and down, it's also about hands out and in, and hands in this way, right? So, in order to make sure that your musculoskeletal system stays functional and active, you need to make sure that you move each and every of these areas. All right, and that's why this exercise is important. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Next, you have to turn to this way. So wherever you're sitting, if you have a chair, all you need to do is rotate like this, 1, and then on the other side, 2, 3, 4, 5, 6, 7, 8, 9, and 10, and relax. Now, after that, what we are going to do is a quick relaxation practice. This is called as Jacobson's relaxation technique. What do this technique does? We keep our muscles tensed throughout the day, and we kind of unlearn how to relax those muscles. This method helps you to learn that again. All right. So to do that, what you need to do is first close your eyes. We'll start with the forehead movement. So try to squeeze in your eyebrows as strong as you can. And then at the count of 5, just relax them. Make sure you relax them completely. So let's start. Squeeze in. 1, 2, 3, 4, 5, and then relax. 1, 2, 3, 4, 5. Relax completely. Again, squeeze in. 1, 2, 3, 4, 5, and relax completely. Again, squeeze in. 1, 2, 3, 4, 5, and relax completely. One more time, squeeze in. 1, 2, 3, 4, 5, and relax completely. Next way, we are trying to close the eyes strongly. 1, 2, 3, 4, 5, and then relax. 1, 2, 3, 4, 5. Relax completely. Again, squeeze in. 1, 2, 3, 4, 5, and then relax completely. Again, squeeze in. 1, 2, 3, 4, 5. Relax completely. Again, 1, 2, 3, 4, 5. Then relax completely. Again, 1, 2, 3, 4, 5. Relax completely. And one more time. 1, 2, 3, 4, 5. And relax. Now, the next is breathing practice. So, close your eyes, observe yourself breathing. Keep breathing. Slowly now open your eyes, rub your hands, dab your face, and relax. So, guys, this was a quick exercise session to warm you up for the day. Now, it's time to move on to the next part or the next session of the day where we are going to understand and learn about hormonal imbalances, hormonal health for women, its interplay in women's life, and how changing hormones can affect or impact women's life in today's time. And to talk about it with me is dietitian Ritu Kapoor, who is our official dietitian who takes care of our patients at Health Q Rehab. She is an expert dietitian who would be kind of talking about hormonal health. Thank you so much, Ms. Ritu, for joining today's session.
Thank you. Thank you so much, Meghna.
Right. So before we start, I just want a quick. I want just you to just take a quick moment and give a small introduction about yourself, why you chose women's health, and why you chose hormonal health as the topic of today. Before we start on.
Definitely, definitely. Thank you so much, Meghna. So, good afternoon, everybody, and I wish you all a very happy International Women's Day. And to tell you that you have to be proud of yourself because we are multitaskers. Whenever we are doing things, we are doing multiple things at the same time, and that is what shows in our hormones also. It's so beautifully related. Sorry about that. So, whenever we talk, and that is why I chose this particular moment to talk about hormones today. Because when I see my patients, like every woman I see, I feel from entering into menstruation, that is menarche, to menopause, they are facing some other issues. So at least when we talk openly about it, when we talk openly about menstruation, we are able to understand that we are not alone who is suffering. Every woman is undergoing some or the other changes, and it's so beautiful whether we are suffering PMS or we are suffering menopause. Whatever emotions we are undergoing, it is because of the hormones and hormonal changes. So I always feel, and I want to state very strongly from this stage today, that when you are suffering something, don't take it on yourself. Sometimes the family puts the blame on us, that oh, what has happened to you all of a sudden, why are you behaving this way? You have to understand it is a hormonal change that you are happening, that is making you undergo all those emotions. So you don't have to blame yourself for anything. Okay, that is what we are going to talk about today. So let me just begin by sharing my slides, and that will make more sense to us then. Can you see the slides, Meghna? Meghna, are the slides visible?
Yes, yes, they are visible.
Okay. So let's talk about this, a very, very important topic today in today's time, that is understanding women's hormones. Okay, what we are going to cover today is we will understand the female hormones, what different type of hormones we have, the health issues that happen during menarche and teenage years, the reproductive years and the fertility part, perimenopause and menopause, and then the holistic approach to female health. So first of all, let's just understand what are hormones. Like, what are we talking about today? Okay, so hormones, they are chemical messengers. So they are actually chemicals. Okay, so our body also has something inside which are chemicals. So these are those things. They are messengers. Messengers means what? They transmit messages. So they are a mode of transmission in the body. So they are produced in one place and they are released into the bloodstream, and then they carry the messages to other parts of the body. So and every small thing in the body that happens, like from breathing, changing food into energy, reproduction, physical development, emotions, regulating your blood sugar, they are all a result of hormone production and action. And in women or in men, there are two major hormones, sex hormones. In women, we have estrogen, and men, we have testosterone.
And also women also have a small amount of testosterone being produced, and men also have small amount of estrogen produced in them. Okay, so this is what the female endocrine hormone system is like. We have the parathyroid glands, which are located very close to the thyroid gland in the neck area. We have the thymus gland, which is in the chest area, okay, which is responsible for the immunity. From the birth up, it is active, and then it kind of takes a back seat. Then we have the pancreas, which we all know about, is the most active gland in the body in terms of digestion. We have the adrenal gland, which is seated on top of the kidney and which produces a major hormone called cortisol. And we, of course, we have the female hormones which are produced by the ovaries. And above all this, there is a regulator which is there in the body. Like, there is a person who is who has, overseeing the symphony being created. So that is done by the hypothalamus and the pituitary gland and the pineal gland, which is the top of all glands, which is also playing a role in all this symphony production. So this is actually a very congested slide, but I'm not going to go into all these details. But it is just to show that hypothalamus is the main gland that is there in the body, which is responsible for a lot of things like body temperature, hunger, mood, sleep. Pineal gland, which is important for your sleep because it produces the melatonin hormone, and we have the pituitary gland, thyroid gland, parathyroid gland. So all these glands are producing some or the other hormones. And on top of this, the ovaries that the females have a production of other hormones also happening. Like we have the progesterone, the estradiol, estrone, and on top of that there is FSH, LH. All these working together in a synchronized manner with one another, and then the result is your outcome of your female body. So this is very well shown and depicted in this ovulation cycle here. As you can see, when one hormone rises, the other hormone goes down, and as a result of that hormone, then the other hormone goes down, and then the first hormone rises. So you can see here estrogen and progesterone, they play this role, and because of this intermittent role happening between them, we have the production of FSH and LH also happening in between. Because of this only, the ovulation happens. So this slide is very important for us to understand that if FSH and LH are out of tune in the body, the ovulation will be disrupted. And that is what results when we have PCOD or PCOS happening in young girls. So this is the entire phase that a woman goes through, and you go through a lot of changes, and a lot of hormones are regulating your body, and that is what makes us multitaskers also. So, and then, we have the feedback loop which is there. Like I told you, each hormone is regulated by the other hormone. When the one hormone goes down, the other hormone rises up. So there is a complex feedback loop that is working all the time in this behind the scene action that is going on in this synchronization. So in the case of menstrual cycle, if you see, there are three feedback loops at play. So it is controlled by the main gland, that is the hypothalamus, which would be regulated by the anterior pituitary, the ovaries, the endometrium, that is the lining of the uterus that is happening. All these are happening at one time or the other, and also releasing FSH and LH in that process. Now, when we talk about the younger years, when a girl just starts off with the periods, okay, that might start off at any age between, nowadays it even happens before 11 years sometimes, but it can happen any time between 10 years to 13 years. In between that, when a girl undergoes changes in the body, it is quite normal for her to have irregular cycles, okay, because the hormone synchronization is just starting to take place. So if a girl doesn't have periods regularly, or if the bleeding is not, to that extent, it is not abnormal to be in that phase. Okay, and it also means that the time your first day of the to the last period can up to the start of next period is less than 24 days, or it can be even more than 38 days in some girls. Okay, so it is a normal thing to be taken slowly. It will get regulated, it will get into rhythm. But only thing is, when how we have to get it into rhythm, we should be following certain things which I'll be talking about later. Okay, we have primary dysmenorrhea in this case, which is a more common type of dysmenorrhea, because the pain usually happens. Why it happens is because of the contraction of the uterus. Now, when the uterus contracts, the uterine lining has to get shed, and that is the time when the women or young girls, they can feel pain during their periods. So it is a completely normal thing. There's nothing something very abnormal. But yes, if it is some kind of a pain which is very difficult for you to handle, then of course you can go for some medicine in consultation with your gynae. But normally it is better to avoid if you can tolerate the pain. Okay, so and then there are other things like PMS, that is premenstrual syndrome. Premenstrual syndrome also happens because the hormones are going up and down. Because of this fluctuation in the levels, the exhibit of that is that we'll have certain emotional ups and downs also. Okay, so this usually starts before the ovulation happens. Sorry, before the period start. After the ovulation, this emotional up and down will be there, and it's a normal thing for most of us, right? Now, managing menstrual issues. How do one manage these things? So, the idea is to have a balanced diet. Balanced diet which has to be rich in iron. Iron is the most important element in this respect that will be required, because iron is the one which makes up your blood. So if you are low on iron, you would be facing issues. You might be having more pain during your periods. So it is optimal that if you can have iron rich foods, it would be best. Calcium is another important nutrient during that phase, because this is also a phase for growth spurt to happen in girls. So the bones are also growing. So there has to be enough calcium so that the bones are made stronger, along with the other thing that is required is vitamin D. Hydration becomes very important, because see, the water is only forming the blood that is there in the body, the fluid that is happening. Now usually, kids these days, especially in Bangalore like place, they do not take enough water. Okay, so hydration is very important, and in terms of having pure water, not juice or coffee or tea. Sometimes they feel, okay, if I'm having milk also, it is hydration. Yes, it is hydration, but it will not substitute for the water that you need. Exercise and yoga for pain relief, it helps big time. So if anybody is facing, I when I joined, I could get that Dr. Meghna was also talking about, breathing in, breathing out. That also helps when you do pranayama and you do exercise and yoga. It helps for pain relief. Stress management, we talk in this particular because we know kids are stressed out completely these days, especially that age group from maybe 11 years till 16 years is the time that you have your senior classes also happening, and you are under a lot of pressure from your friends, your school, to study hard. And that is why also sleep also takes a back seat. So if I will tell you one particular tip that you can take from here is, first, you have to sleep properly. If you learn to sleep properly, you will be able to manage most of the things that happen in life. The reproductive years and fertility, when we talk about, going ahead from the teenage years. Secondary dysmenorrhea can happen. Usually, it is because of certain issues that are there. It can be because of endometriosis or have certain fibroids being there or cysts being present. So, this has to be evaluated properly by a doctor, and you have to be under the consultation of a doctor for this. So if any of the things can happening, don't postpone it, don't just suffer with it. Talk to a doctor, get it evaluated and get it sorted. Now, there are a lot of endocrine disruptors for female hormones, and that is what makes it difficult in today's time. Okay, because when we are talking about so many hormones regulating our functions, we have to make sure that the environment that we are living in is not disrupting these hormones. Now, why would they disrupt these hormones? Because they are all chemicals, like I talked about. Hormone is also a chemical, and these disruptors are also chemicals which are present in our environment. So, when we expose ourselves to these environmental chemicals, they can mimic the action of the hormone in the body. But they can mimic the action, but they will not perform the same function of the hormone. So, it is like a lock and key mechanism, as you can understand from this picture. Like, suppose a hormone looks like an inverted triangle, and a disruptor is like a diamond. Now, if we see the lock which is there, this key is fitting into that lock because it has the same shape. Okay, but these are not the same molecules. So when they work at the cellular level, this hormone, what action it will perform, this chemical, it will not be able to perform that. And how do we get these chemicals in our environment? We can get it from everything that we are using. The plastics, we can get it from the cosmetics, we can even get it from all the soaps, the toothpastes, everything that you use can have these disruptors. So you have to go back and you have to identify what kind of an environment are you living in, and you have to start cleaning out. The way we used to live, I will say, when I was a child, we had minimal usage of these chemicals. So that environment we need to go back to. Okay, and this, whenever it happens, see, when the dermal absorption is there, or we are inhalation or ingestion, it can even be transmitted to the fetus. So it has a transgenerational effect on the coming generations. Now, this also is very, very important, which I see often, in my practice. Stress impacts hormones big time, and we have to accept that, and we have to accept that we have to do stress management. So it leads to lower estrogen production, which is a main hormone. Women will have irregular or no ovulation. Lower progesterone production is there because it blocks the progesterone receptors. Testosterone gets low, libido is low, thyroid hormone imbalance happens. These are all because of stress. Okay, and it is very, very logical. We do not have the time to discuss today how stress will be impacting the hormones in a actual manner, but if somebody wants, I can definitely share data and information later on. Now, nutrition for fertility and pregnancy, when we see folic acid, so your nutrition part will start before you start a pregnancy or your plan for a pregnancy. Okay, so to have a healthy baby, it is important that you have a healthy body. So that's why it is important. So folic acid and other essential vitamins are important before you get pregnant. Protein and healthy fats are important throughout. Foods to avoid, you should definitely avoid during pregnancy. There are certain foods, again, your junk food, your cold drinks, everything that comes with chemical and additives has to be avoided. Staying active during pregnancy is very, very important, unless and until you have a certain condition where you cannot do that. Now, there is another condition that a woman goes through after pregnancy is your perimenopause and your menopause stage. Okay, so during this, women will undergo through hot flushes, night sweats, vaginal dryness, there will be libido will be low, mood changes will be there, sleep disturbances will happen, even osteoporosis and heart risk disease is there. Why does this happen? This happens because the estrogen hormone is primarily responsible, like it will help in the uptake of calcium also in the body. So when the estrogen level goes down, the uptake of calcium in the bones gets affected. And because of this, the osteoporosis will start happening if you do not take care of it from your diet or a supplementation if needed. Okay. Heart disease risk also increases because again estrogen plays a very important role in protecting the heart from various things. So because of which the women undergoes a lot of things. But once you become aware, like I am a person who already hit my menopause, but I am aware of how I'm supposed to take care of these particular things. So once that awareness comes, you can take charge. Now, estrogen, when we are talking about estrogen, estrogen is the main regulator, the master regulator that is there, in almost all processes that undergo in a female. So, but we have different types of estrogen being produced. Okay, so there is an estradiol which is produced by the ovaries. There is estriol which is produced in the placenta during pregnancy, and there is estrone which is produced by adrenal glands and fatty tissue. So even when estradiol goes down in the ovaries, the estrone is there in the adrenal glands which will take up and which will play a role in menopause to do the functions what a female body requires to be done. But at the same time, the efficiency of this estrone is not the same as the estradiol. So there will be some differences which will be there. That is why females they generally tend to gain more fat in the belly area. Okay, when once menopause hits, or even in the perimenopause stage, there is a rapid weight gain that happens if you're not careful about your workout, if you're not careful about your diet. The weight gain will keep happening. Okay, so if I always tell women when they come to me, if they get a thing, I get to meet them, in their 35, 38 years, before 40 years, I will tell them, please take charge of your weight now. Don't wait, okay, I will enter into perimenopause, then I will start taking care of myself. No, by the time it is little late, when once you start taking care of yourself by 38, before you hit 40, you can enter into a very nicely into your perimenopause and menopause without any side, symptoms as such happening, which can be disturbing. So I always, women, we always take a back seat when it comes when we are taking care of our family, we are taking care of our jobs, we are doing so many things. We keep our health on the back burner. But you just see yourself, you try to see an instance which would have happened in your life at any point of time, you will realize that if your health is not okay, you will not be able to take care of your family's health. And if you are not, if your health is affected, there is nobody to take care of you. That is the first thing. So you should always give yourself a priority and take care of your health. Now, in case of menopause symptoms, there are a number of things that can be done to handle. The first of all is talk to you other women, about it, because talking also helps. We know that. Phytoestrogens and herbal remedies are there which help in taking care of some of the menopause symptoms. Regular exercise and yoga also helps because it helps in strengthening the bones, and it helps in taking care of various aches and pains that happens during this period. Stress reduction techniques like mindfulness, meditation, they also help big time. Bone health, has to be taken care of, because when once you start losing out on your hormone, which is a main hormone which is for your bones, slowly when you go into your other 60 and above, there are chances that your bones will become very weak. So from that early stage only, you should start taking care of your bone health in terms of your calcium, your vitamin D, and also your weight bearing exercises. We always, worry about our belly. We say, oh, our belly has become like this, it's gained fat, I'm looking so bad. But we do not take care of your lower part of the body. If you lose strength on the lower part, that is your thighs and your legs, you will definitely get belly fat. So it's better to focus on this particular area, the lower part of, by itself, the belly fat gets taken care of. Okay, so these are some of the hormones that are there, which are there during menopause transition, which go up and down again, the luteinizing, anti-Mullerian hormones. Yeah, that's all from my side, and I'm open for questions if somebody wants to ask.
Thank you so much, Ms. Ritu. This was very helpful, and we do have some questions in the chat box. So I'll just take it one by one so that you can answer them. So someone is asking, like, what test women should do regularly for staying healthy?
For staying healthy, tests to do.
Yeah.
Okay,
So usually, what
nowadays.
they, yeah, please go ahead.
Nowadays, see what I'm saying, majority of the women, not only women, but it's a general trend that is happening. They are low on vitamin D and vitamin B12. Okay, I would say even kids are having deficiency these days. Children are also facing this deficiency. So better to keep a tab on that, because once your vitamin D goes very down, you will have mood swings, you will have back pain, you will have lower leg pains happening. So vitamin D, vitamin B12, your iron levels, these are something that you should keep a tab on and keep getting checked, so that at least the basics are clear.
Okay, perfect. The next question is, what women should have to maintain her hemoglobin levels?
See, hemoglobin levels, generally you should take iron rich foods. If somebody wants to ask me, okay, what iron rich foods are there? We have all the green vegetables which are rich in iron. We know that. Okay. In terms of non-vegetarian food, we have, like, a chicken liver or liver is an excellent way in which iron levels come up very fast. So if somebody is extremely low on hemoglobin, they can take, if they're having non-veg, they can have this maybe once or twice in a week, and their hemoglobin levels will improve drastically. But important thing to do with iron supplementation or iron intake is that iron in by itself, it will not get absorbed in the body. So we have to take a vitamin C rich food or rich source along with that iron rich food, so that optimum absorption of iron can happen to raise our hemoglobin levels.
Okay, all right, wonderful. So, ma'am, the next question that the lady is asking is, what a woman should eat during her menstrual cycles to maintain her overall health and prevent pain? Is there any way?
See, usually pain, it happens. Mostly I have seen that if your iron levels are good, okay, and if you're having a healthy, normal, frequent means whatever we are not skipping meals. Okay, if you have to have a breakfast, lunch, dinner, you should have it. It should not happen, okay, I want to maintain myself, I'm skipping out on breakfast, I'm not having my dinner.
Hmm.
It should not happen. Then your body is going to suffer big time. Okay, so first thing is, you should eat properly, you should eat on time, because see, sorry, whenever we're talking about hormones, as I showed you, hormones, they form a routine. Okay, it is so rhythmic in the body. Same way, from morning till night, hormones have a cycle. At what time what hormones are going to get produced, it is so beautifully designed in our body. But if we do not follow that cycle, if we disrupt our activities during the day, then that hormones also don't, function in a proper manner. And that is the time that we come up with PMS, we come up with lot of menstrual issues. Okay, so first thing is at least maintain a rhythmic cycle for yourself, maintain your daily routine which is predictable. And second thing is eat on time. Third thing is if you're suffering too much of pain or something like that before you're like in the first day of the periods, you can try soaking black raisins. You soak it in the night, you have it first thing in the morning, 4 to 5 black raisins. You try it for a month, you will see that your pain will come down.
All right, perfect. Thank you so much. Let's move on to the next question. So, the next question is, ma'am, let us know what are the plant based ways to have protein in our diet?
Yeah, I keep getting this question very often because this protein thing, no, it is doing rounds like anything
Yeah,
in nowadays.
right.
So, see, we have a lot of plants based protein that is there in your diet. Actually, if you're eating on time, if you're eating proper meals, you will get enough protein. You don't have to worry about that. Okay, because our parents, I believe, they were more healthier than us, isn't
Mm,
it?
correct.
They were more healthier and they never went for any protein powder in their time.
Correct.
Only thing was they were eating on time, they were resting properly. We don't give our body proper rest. We just want it to be active all the time. That is not the way to live our lives.
Mm,
Okay?
mhm,
So I would say the plant-based proteins that are there. First thing, all your pulses, your lentils, they are extremely good in proteins. Okay, so that is the first thing. Then your milk and milk products, they are very good option for you. In again there, if you see soya, if soya is a lentil, but if you see off it, you can have soya chunks also as part of it. You can have tofu, you can have paneer, which is also good. In terms of your pulses, you can have as dal or you can have it as sprouts. Okay, so there are multiple ways in which you can plan and you can consume them in a day, so which will be optimal to take boost up your levels. In the vegetables also, we have beans, we have peas, which are good sources of protein. So if you are including all types of those also, it should be able to make up your protein levels.
understood. Great. All right. And then, ma'am, just one more last question is there. This lady is asking that what to include in the diet if if we are underweight.
Okay. Now, see, underweight, there can be other hormonal issues also which can be there. So, first, you have to examine properly, give it a proper this thing as to why you are underweight.
Mm,
If you are underweight, that is from maybe childhood, you have been like that, that your body structure is like that, and you have not been able to gain much weight, that is a different matter altogether. Okay, maybe in that case it can be some genetic effect can be there, or your body structure also only will be like that, that you will not be able to gain weight that fast. Okay, we
right.
have in ayurveda, if we talk, we have different prakritis.
Mm,
Okay, so we have prakritis who are more vata dominant. Now people who are more vata dominant, they will be lower on the weight.
right.
Okay, so that is also the case. So if it is something that has happened now to you, that you have lost your weight all of a sudden and you're not able to gain weight, that is a different situation. It can be nowadays even because of IBS. People are losing a lot of weight and they're not able to gain it back. So you have to check basically what is your digestion like, whether you are able to properly digest and assimilate food. Digestion is one part, using that nutrition and absorption in your body is another part. Okay,
Right.
that has to be checked. Only after these checks are done, I would probably able to suggest you as to what you can eat to gain
Right.
weight.
Right. Absolutely. Absolutely. Thank you so much, ma'am, for all the wonderful insights and suggestions that you have given. I hope our audience also found it very interesting. So, we just ran a poll some days back about the session, and these are the questions that we got, and I hope that we were able to answer them. Wishing you a very happy Women's Day. Thank you so much for the good work that you're doing for people. Diet and nutrition is such an integral part of every individual. And when it comes to women's health, I think women ignore their health the most, and they kind of keep their own nutrition at the back seat to take care of the nutrition of the other family members. So we are trying to make that one effort to raise awareness about the nutrition level of women, so through these kind of events, and I hope you all were able to find value through it. Thank you so much, ma'am. Thank you for joining.
So much,
And
Dr. Lina, for inviting me here.
right, looking forward to have more such sessions with you. Bye bye. Thank
Bye
you.
bye. Yeah.
All right, guys. So this was a very interesting session on your hormonal health. If you want to take a personalized consultation with Ms. Ritu Kapoor, she is our nutritionist on board and she is available at our Sarjapur Center. At the same time, if you want to take a virtual session with her, feel free to reach out to us in the comment section. We have already mentioned all our contact details. Now it's time for a lunch break, so we will be connecting back sharp at 2 p.m. With a very interesting talk on mental health. So, looking forward to see you there. Till then, have a nice break time and come back again. Looking forward to see you. Bye bye. Hello, everyone. Welcome back again to today's women's health session that's going on. And we are back again with our next set of activities where we are starting with our first activity, which is on your mental health, your emotional well being. And to talk about this with me is Dr. Okay, am I audible, guys? Hello, 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 am I audible? Hello, am I audible? Can you just raise a thumbs up if I'm audible? All right, perfect. Okay, guys, thank you so much for joining again. We are again back with our set of activities, and we are talking about managing stress and anxiety in women. And to talk about this, we have Dr. Akash Shah with us, who is going to take a lead here, who is a psychotherapist, a dentist, a lawyer, and he plays a lot many roles. But most importantly, he takes care of our patients at Healthcare Rehab when it comes to mental health challenges. So he has a lot of insights to share with you all, and that's why I'm here to invite him. And yes, Akash, so over to you. Take over the stage and share your insightful knowledge with everyone. So some audio issues coming. Can you just try to rejoin again? Hello, hello, hello. Am I audible? Guys, just put a thumbs up in the chat box so that I can get an idea if I'm audible enough. If anybody can just put a thumbs up in the chat box. Am I audible well? All right, so let's wait for Akash to join again. All right. So Akash, am I audible to you? Okay. All right. Let's get started. Over to you, Akash. Without wasting any time. I think there is some voice challenge coming.
Hello. Mic check. Hello. Mic check. No. Hello. Uh, hello. Am I audible? Yeah. Ma'am, am I audible now?
Yes, you are audible now.
No. Hello. Mic check. Am I audible?
Yes, you are audible now.
Yeah. So, very good afternoon, everyone. And once again, thank you, ma'am, for the warm introduction. So, let us begin today's topic with one of the most common scenarios that every woman face in their day-to-day life. Let's imagine a woman in her 40s. Let's call her Meera. Meera is a full time working professional. She has a full time job. She also takes care of her family. She does daily routine household chores as well and still tries to find some time for herself. Amidst all this, she gets physically drained and mentally exhausted. Meera visits n number of doctors and takes n number of medications, but nothing works in the long run. You know why? Because Meera focuses only on her physical health and forgets to focus on one of the most important element, which is her mental health. Wish you all a very happy Women's Day. Today we are here to celebrate the resilience, the strength and the achievement of every woman out here. And do you know what is the best way to empower a woman? The best way to empower a woman is by taking care of her health, that is both physical and mental. That's the reason I am here today. So, hello everyone, I am Dr. Akash Shah, your mindset counselor, and I'm working in this field for more than 10 years now. For the past 3 years, I have had privilege to work with HealthQ team, and I really admire HealthQ rehab team a lot. You know why? Because HealthQ rehab team is the only physiotherapy team that I know that focuses equally on physical health and mental health. I think that is the reason, that is the holistic approach of HealthQ rehab, which brings us all on this platform together. Am I right? So is everyone with me? Can I see some thumbs up? Yeah, everyone there? Yeah, okay, good. So, friends, did you know that once any physical therapy like physiotherapy, when it is combined with mental health therapy like mindset counseling, we get good results. That is, results are elevated up to 30 to 40%. You know why? Because stress isn't just physical. Stress, anxiety, and depression worsens musculoskeletal conditions that also delays our healing response and increase the perception of pain. That's where mindset plays an important role in our complete well-being. When we manage our stress and emotions in the right way, our body responds to pain faster, our body heals faster, and our musculoskeletal conditions improves in very right manner. So that is the reason for our today's session. In today's session, I'll be sharing 5 important techniques which you can easily practice, which will help you not only fight your stress and depression, but which will also boost your musculoskeletal health. So let's get started with the techniques, right? Is everyone there? Are we on the same page? Yeah, are we on the same page? Okay, so let us start with our first technique, that is progressive muscle relaxation technique. Okay, before we begin with the technique, let me tell you a story of Ria, our 35-year-old patient. Ria is a young mother, and when she visited us, she had complaint of chronic pain in her neck and shoulders. The pain continuously increased when she was under stress or strain, and even after taking many medications, the pain did not subside to the great extent. So that's when she approached HealthQ Rehab. So, along with her physiotherapy sessions, we started her mindset sessions, and after that, she noticed that her pain was gradually reducing. After introduction to the progressive muscle relaxation, that is PMR technique, she felt very comfortable both physically and mentally. So today I'll teach you one of this technique, one important technique, that is PMR technique. So let us do it together. In this technique, what all you have to do is you have to just sit back and follow my instructions. Follow whatever I am telling. You don't have to make any notes because this PPT will be there on YouTube for life. And also I have created a handbook of these 5 techniques, which I'll share with Health Rehab team, and you can download it from our portal. Okay. So now let us continue with the first technique, which is progressive muscle relaxation or PMR technique. So just sit back, just relax and gently close your eyes and just concentrate on your breathing. All you have to do is just focus on my instructions and suggestions. Okay. So just concentrate on your breathing. Take a deep breath in and slowly exhale through your mouth. Repeat it once again. Take a deep breath in and slowly exhale through your mouth. Let me tell you, friends, progressive muscle relaxation is a technique that works on the principle of tension and relaxation. So here we will tense group of muscles one by one and then relax those muscles one by one. This will teach our body the difference between tension and relaxation. So let's start with it. Firstly, curl your feet for 5 seconds. Increase the tension on your feet for 5 seconds. Do it now. 1, 2, 3, 4, and 5. Relax. Now relax your feet. Now focus your attention on your calf muscles. Increase the tension of your calf muscles for 5 seconds. 1, 2, 3, 4, and 5. Now gently relax your calf muscles. Now focus on your thighs. Increase the tension on your thighs for 5 seconds. 1, 2, 3, 4, and 5. Relax your thigh muscles completely. Now focus on your abdomen and squeeze your abdomen and abdominal muscles for 5 seconds. 1, 2, 3, 4, and 5. Relax your abdomen. And now focus on your fist and clench your fist for 5 seconds. 1, 2, 3, 4, and 5. Relax your fist. And now focus on your shoulders and shrug your shoulders for 5 seconds. That is, take your shoulders close to your ears and increase the tension of your shoulders for 5 seconds. 1, 2, 3, 4, and 5. And now concentrate on your face and scrunch your facial muscles for 5 seconds. Just scrunch your face for 5 seconds. 1, 2, 3, 4, 5. Just relax. Once again, concentrate on your breathing. Just concentrate on your breathing. Just concentrate on your breathing. Take a deep breath in. Slowly exhale through your mouth. Once again, take a deep breath in and gently exhale through your mouth. So when you feel comfortable, slowly open your eyes. So friends, how are you feeling? How are you all feeling right now? Yeah? Anyone in the comments? Do let me know how you are feeling in the comments below. Along with the talk, I am also focusing on the comments. Okay, I want active participation from everyone. So how are you all doing? Feeling good after the technique? Feeling relaxed after the lunch break? Okay, that's great. Yeah. So friends, this was our first technique, that is PMR technique. And as you can see on the screen, it helps us reduce muscle stiffness, enhances blood circulation, and also lowers cortisol. Cortisol is the stress hormone which is responsible for inflammation not only in joints but also in muscles. So once our stress is reduced by this technique, cortisol level automatically drops. So this is our first technique, which is PMR technique. This is a very easy to do technique. You can practice it whenever you are in stress, and even you can practice this technique before your physiotherapy or any other physical therapy sessions. Okay, am I clear? Now, before we move to our second technique, let me give you a brief idea about this technique, a small story of a patient. So, Radhika came to us, a 45-year-old female, with pain in her lower back. She had chronic pain in her lower back and she was not even able to sleep properly. So, when we interrogated Radhika, when we had a consultation session with Radhika, we found that she was constantly under strain. When she came to Health Q Rehab Center for physiotherapy session, our therapist noticed that Radhika's breathing was very shallow and she was consistently under stress or strain. Her mind was running constantly. That's when she was referred to me for mindset sessions. And the technique which we introduced to Radhika was box breathing technique. Yeah, just let me open the slide. Yeah. So we introduced Radhika to second technique, that is box breathing technique, which is also known as Navy SEAL technique. So friends, you all will be amazed to know that this is a very important technique which is practiced by higher officials or even big surgeons before their surgeries or operations. This technique is very small, very easy to practice, but gives us quick results. Okay, so again, all you have to do is just sit back, relax, and follow my instructions. So is everyone ready to practice box breathing with me? Yeah, everyone? Are we all on the same page? Yes, okay. Yeah, I can see some thumbs up. Good, okay. Okay. Chalo, so let's start with box breathing. So everyone again sit back, relax and close your eyes. And again concentrate on your breathing. Yes, thank you Samruddhi, thank you Bharti ma'am, thank you Revant Sid, thank you Chandrasekhar sir, thank you everyone for being on the same page with me. Yeah, so let's continue with box breathing. So sit back and relax. Gently close your eyes and take a deep breath in and slowly exhale. Box breathing technique has 4 steps. In the first step, we inhale for 4 seconds. In the second step, we hold that breath for 4 seconds. In the third step, we again exhale for 4 seconds. And in the fourth step, we again hold back for 4 seconds. Just start doing this technique with me and you will feel its results. You will know its results. Okay? So take a deep breath in for 4 seconds. 1, 2, 3, 4. Hold your breath for 4 seconds. 1, 2, 3, 4. Exhale through your mouth for 4 seconds. 1, 2, 3, 4. And again hold for 4 seconds. 1, 2, 3, and 4. Let's do this one more time. Take a deep breath in for 4 seconds. 1, 2, 3, 4. Hold on for 4 seconds. 1, 2, 3, 4. Slowly exhale for 4 seconds. 1, 2, 3, 4. And again hold for 4 seconds. 1, 2, 3, and 4. Let's repeat this one last time. Inhale for 4 seconds. 1, 2, 3, 4. Hold on for 4 seconds. 1, 2, 3, 4. Exhale for 4 seconds. 1, 2, 3, 4. And finally hold for 4 seconds. 1, 2, 3, 4. Just relax your body and mind. Just relax. And when you feel comfortable, you can slowly open your eyes. How was it, friends? Feeling relaxed? Feeling better? Yes, RK has told that feeling relaxed. Very nice. Yeah. Okay. So thank you everyone for your active participation. I can see the comment section. It is very active and full of comments and appreciation. Thank you very much. So friends, our breathing has direct connection with our parasympathetic nervous system. Okay. So once we control our breath or once we calm our breath, we automatically calm our body. So whenever you are under strain, whenever you are under stress, or even before some important presentation, if you practice box breathing, you will notice that your heart rate gradually reduces. Your breath rate also reduces and you feel very calm and relaxed. So to be honest, friends, even I do it every time before my presentation, and I did at least 10 times box breathing before starting today's presentation because it really helps you to relax and it helps you in giving your best. So this is all about box breathing. Okay, even this, as you can see on the screen, box breathing lowers cortisol, which is the inflammation hormone, and it also improves oxygen in your brain. So now we have completed 2 techniques and 3 more techniques to go, right? How everyone is feeling? Yeah, good. So friends, I would like to share one more thing that at the end of this session, I have a small surprise for you all on the occasion of Women's Day. But for that surprise, you have to wait a bit. Okay. The third technique is one of my personal favorite techniques, and I'm practicing that technique since more than 10 years. It is the oldest technique which I know and which I have recommended to many of our patients, and every patient, each and every patient gives me a good and positive feedback. Okay, so now let me introduce you all to Neha. Who is Neha? Neha is a 28-year-old young enthusiastic entrepreneur. She came to HealthQ Rehab for her lower back pain and middle back pain. Despite of many medications, many treatments, her pain refused to go. And when we started her physiotherapy, she told us that her mind consistently races. Her minds don't stop. At night she wants to sleep. Her body needs rest, but her mind is consistently thinking something or the another. And that's when she was referred for mindset counseling. So the technique which I introduced to Neha was a simple technique which is known as journaling. Yeah, journaling. So I told Neha just to write 5 minutes before going to bed whatever comes to her mind. As simple as that. This technique doesn't only look simple, but it is very simple even to implement. Okay? A simple technique that is just journaling 5 minutes before going to bed really helped Neha in the long run. After just 2 to 3 weeks, when I talked to Neha, I saw a new Neha altogether. She was more confident. I can see that she was feeling more fresh. She started getting a good sleep throughout her night. So, journaling is that easy and that effective. Today, let us practice journaling together, okay? If you all can grab a pen and paper with you, then that will be good. I can wait for some time. You all, if you can grab a pen and paper. If even if you don't have pen and paper, you can just on the notepad of your phones. Or one more better thing is you also have live comment section, right? On the phone. So you can just write in the comments below whatever I ask you to do. Sounds simple, right? Don't worry, don't fear for judgment. Today we all are here to help each other grow. Am I right? So let's grow together. And this Women's Day, I want everyone out there to be mentally very, very, very free and mentally very, very, very healthy. Okay? So now let us start with journaling. There are 4 steps that we have created for journaling. It is a template which will help you in easy journaling. So before we begin, just close your eyes for a minute and let your brain and mind calm down. Just close your eyes and relax. Take a deep breath in. Slowly relax. Once again, take a deep breath in. Slowly relax. Take a deep breath in. Slowly relax. Now, here are 4 steps of journaling. You can open your eyes and you can start with one step at a time. The first step is known as brain dump. In this step, what you have to do is you have to just pour your mind and heart out on your paper or in the notepad or in the comment below. For 1 minute, just write whatever comes to your mind. Don't stop yourself. Don't worry about judgment or from others. Just go ahead and pour your heart and mind out. Okay? This is first step, which is brain dump. Just write whatever comes to your mind. And your 1 minute starts now. Let your thoughts flow smoothly. Write whatever comes to your mind. Just write whatever comes to your mind. Your problems, your worries, anything that is causing stress in you, anything that is causing strain in you, any pain in your body, any discomfort. Just pour everything out on the paper. Just pour out everything on the paper. Try to make the most use of this 1 minute and try to write whatever you can on the paper. Are you all done? Your 1 minute time is over. So, in the second step, all I want you to do is just close your eyes and think about that one thing or that one pain that is bothering you right now. In the first step, we just wrote everything that came to our mind. But now I want you to focus on one thing that is bothering you the most. So just close your eyes for 1 minute. And when I ask you to open your eyes, just start writing about that one thing which is bothering you the most. So close your eyes for 1 minute. Just think about the problem that is bothering you the most right now. Just think about that one problem that is bothering you right now. And now open your eyes and just write about that one problem that is bothering you right now for 1 more minute. Your 1 minute time starts now. Just write about that one problem that is bothering you right now. No more clutter, no other thoughts, only one problem. Let's tackle everything but one at a time. One at a time. One at a time. 30 seconds to go, friends. Time's up. And now it's time for our third step. So, friends, in the first two steps, we told our brain and mind that yes, we have many problems in our life. Okay. But in the third step, we are giving a surety to our brain that along with problems, I have many other things as well for which I am grateful, for which I am thankful. Because gratitude really does wonders. So, in the next 1 minute, I want you to write about 3 to 4 things you are thankful for. Okay, write about all those 3 to 4 things you are thankful for. It can be as small as a cup of coffee which you loved, or a message from a friend, or the fact that you are attending today's session. It can be anything. Okay, now take your 1 minute time and write about 3 to 4 things you are thankful for. Your 1 minute starts now. Done? Done with gratitude writing? Done with thankfulness? Yes, everyone? Okay. So now the last point is taking action. Now again concentrate on your point number 2, the problem that was bothering you the most. Okay? And in next 1 minute, just think about one small solution, one small step that you can take towards improving your problem number 2, problem that you had mentioned in your second point. I don't want you to write a big solution, just a small step. For example, if it is a tough thing, then you can just read about it, start reading about it, or you can just take someone's help, or you can just breathe it and let go. If it is some relationship issue, you can just make the first step towards talking. Any one small step that you know will help you improve your point number 2, or help you with your problem in point number 2. Okay, your 1 minute starts now. Okay, focus on point number 2 and write all the possibilities about managing it, but one step at a time. 30 seconds done, and we are left with 30 seconds only. Yeah, last 10 seconds. Hurry up, friends. Just pour your thoughts out. And we are done. So, friends, this simple act of journaling can do wonders. So, after writing for just 4 minutes, how are you feeling? Yeah, anyone in the comments? How are you feeling right now? Yes, anyone? That's great. Okay, you're feeling good, you're feeling great. Very nice. So, friends, you have to just practice this template almost every day before you sleep. And this will give you solutions oriented journaling. This is called solution oriented journaling. We are just not writing blindly, but at the end, we are coming to a conclusion every day. And you will find that after every day passing, your mind will give you better and better solutions as you practice this technique more and more. Okay. So, friends, we have finished 3 techniques so far. Okay. Third is my favorite, as I told you. But which technique did you like so far? I would like to know it in the comments. Which among the 3 techniques is your favorite and which you will definitely practice on your regular basis? Yes, anyone? Which technique would you love to practice on your daily basis? I'm checking the comments. Yeah. Anyone among the 3 techniques, which one is your favorite? The Navy SEAL technique, box breathing. Okay. Yeah, it is an amazing technique. So, friends, now let's go towards our fourth technique, which is also very important technique. And I have modified that technique in a huge manner, in a great amount. Okay. So, before I go to fourth technique, let me tell you story of Ananya. Ananya came to us because of her chronic neck and shoulder pain again. She also had back pain. Okay, everyone is loving box breathing technique. Yeah. Okay, it is really interesting technique and I want everyone to practice it regularly, okay? So now let's move towards the case of Ananya. Ananya had chronic back pain, she had neck pain, she also had shoulder pain. She told us that she is a working professional who works for around 10 to 12 hours a day, and because she sits for long working hours, she has pain in her back. But after an interrogation, like after mindset counseling session, after the initial session itself, we found that there is something missing. There are some links which we are not able to get it. There is something that Ananya herself doesn't know about herself, which is bothering her. So when I started with counseling sessions, initially I started with minor sessions, and then when we went to major sessions, one of the major sessions that I conducted was age regression session. And we went back into her ages and we found that there are many emotions, many childhood traumas, many relationship traumas that Ananya was holding back in her mind. Because of these traumas, because of all the grudges, there was no space for healing. There was no space for good emotions because there were many negative emotions buried deep inside Ananya. And that's when I introduced her to one of the most interesting technique, which is known as the helium balloon release technique. Once Ananya started practicing this technique, initially she was very reluctant to express, but slowly, with the technique, she felt more and more lighter. Even our physiotherapist told me that she was now responding to treatment better after few sessions. So this important technique, today we will be learning about the same. So it is the helium balloon release technique. So just let me open the slide for you. Yeah. So again, just close your eyes Sit back and listen to my instructions and my suggestions. Just close your eyes and relax. Friends, now I want you to focus on that part of your body which has musculoskeletal issues or which are painful at present. It can be your neck, it can be your shoulders, your back, your knee, or any other part of your body that comes to your mind at present. Okay? Just focus on that part and try to experience the pain which is present there. Just try to know what type of pain is present there. Just give yourself 1 or 2 minutes and try to just think of that pain. Just focus on that pain for next 1 minute. All I want you to do is just focus on your pain and just think what comes to your mind, what emotions come to your mind when you are thinking of that pain. Whether it is stress, whether it is strain, whether it is anger, hopelessness, helplessness, worry, whatever comes to your mind, just make a note of that emotion. Concentrate on that pain and make a note of the emotion which is associated with that pain. Okay? And now imagine that there is an helium balloon in your hand, the gas balloon in your hand. And with an invisible marker, write that emotion on that balloon. Whatever emotion that came to your mind, whether it's stress, it's anxiety, it's depression, whatever it may be, just write that emotion on that balloon. And now, once you are done writing, take a deep breath in and gently exhale. And while you exhale, just leave that helium balloon in air. And notice that when the helium balloon is moving deep in the skies, with the balloon, your pain is also reducing. As we have expressed the emotion, our body has also started responding better to pain. The pain which you had earlier now feels bit better. I will not say that it has vanished completely, it's just the first time we are doing it, but you will definitely feel better. And once the balloon is off, you are feeling quite better. You're feeling much better. You're feeling much better. Just concentrate on your breathing again. Just concentrate on your breathing. Just relax. Breathe in all the positivity and breathe out all the pain, all the stress and tension in your body. Now you can slowly open your eyes. So, friends, how was this technique? I hope it will help you the way it also helped Ananya, right? This technique looks very small, but they are very, very, very effective. They are all time tested and scientifically proven. All the techniques which I am sharing with you all, we have used these techniques for more than 5 to 7 years, and each and every patient of us has been benefited with all these techniques. Okay, so I would request you all to just give some time to these techniques, practice these techniques for around 10 to 15 days and see which techniques works the best for you. Okay, so now let us move towards our last technique. Are you all excited? Yeah, can I see some movement in the comments? How are you feeling, guys? We are almost done with our 90% of lecture. 90% of talk is done. Just 10% to go. And yes, surprise awaits at the end. How are you feeling? Feeling good? Feeling better? And as you can see on the screen, the helium balloon reset will help you on psychological reset, and it will help you improve mind body connection and many other things. So, feeling good? Okay. Mm-hmm. Yeah, I can see some good replies in the comments. Okay. So the last technique which I'm sharing is again one of my favorite, and the last case study is also one of my favorite, because in her case we found results very fast, very soon, and the patient was very happy. And I'm happy to share that today itself she messaged me once again that she is feeling very relieved. So this is 38-year-old Pooja who visited us, and her chief complaint was her Bell's palsy. She had a type of facial paralysis which is known as Bell's palsy. So along with physiotherapy session, along with the massages session, we also recommended her mindset session for speedy recovery, because we noticed that there was little thing on her face but more was going on in her mind. Her mind was constantly juggling between past worries and future thoughts. She was just in the past memories and just worried about future, just worried about her future life. So when I consulted her, I knew that one of the best technique that could help Pooja was a grounding technique. So let me change the slide for you. So grounding is the last technique for today, and I'm very sure you will also love this technique and you will implement it as it is very easy to implement. Okay, so sit back, relax, close your eyes, and again focus on your breathing. Concentrate on your breathing. Take a deep breath in and slowly exhale through your mouth. Grounding helps you to be in present. Most of our worries are either because of past or because of the future. But we forget that where we have to live is the present. The more we are in the present, the less worried we get. And grounding is that technique which will help you to be in present. Okay? So now you can open your eyes and tell me or make a note of 5 things that you can see around you. It can be your phone, the walls, the laptop, the glass, the cup, your air conditioner, your fan, anything. Make a note of 5 things that you can see. One, two, three, four, and five. Good. Now, make a note of 4 things that you can touch. It can be anything, like maybe your own glasses, your phone, your laptop which is in front of you, the cup which you have with you, or anything. Make a note of 4 things that you can touch. Okay? Done? Now make a note of 3 things that you can hear. It can be my voice, it can be sound of your air conditioner, it can be sound of your fan, it can be any disturbance in the background, it can be anything. Just make a note of 3 things that you can hear. Done? And now make a note of 2 things that you can smell. That you can smell. It can be just the fragrance of the room which is there, or it can be the fragrance or smell of your own body, your own clothes. It can be anything. Just make a note of 2 things that you can smell. And now, lastly, make a note of 1 thing that you can taste. It can be a sip of water, or it can be the taste in your own mouth to which you have never paid attention. So here we did 5-step grounding, 5, 4, 3, 2, 1 grounding. 5 things which you can see, 4 things which you can touch, 3 things which you can hear, two things which you can smell, and one thing which you can taste. So, did you observe that in this small technique, we have made use of all the five important senses that our body has? We often fail to appreciate these senses, right? But now we realize that each and every sense is so important. And when you focus on these senses at one time, sitting at one place, you automatically just focus on present. I can bet that when you were doing this technique with me, no thought of past or no worries of future came to your mind. Am I right? Yeah, anyone? When you were doing grounding, no thought of your past or no worries of your future troubled you in this last few seconds. Am I right? Right, excellent. So this is the small technique which has immense effect on not only our physical but mental health as well, and also on our musculoskeletal health as well, because all these techniques help you reduce cortisol, which I have mentioned earlier, which is responsible for your musculoskeletal ailments or problems. And all the wonderful women out there, I want you all to practice all these techniques regularly and see what works for you. And after a few days, I would love to hear from you that which technique really helped you and in what way it helped you. So you can reach us on Health Q Rehab portal and you can give your reviews. I will be waiting for reviews from all of you. Okay, so these are the five techniques. Let's have a quick recap of these techniques. So the first technique was, friends, yeah, you got it right, PMR, that is progressive muscle relaxation. Okay, how this technique works? It works by increasing the tension and then releasing the tension on the muscle group, right? So firstly, we just tensed our muscles and we then relaxed them from your feet to your face. We just moved slowly upwards and we just relaxed each and every muscle of our body. This technique taught our body the difference between tension and relaxation. Okay, so the second technique, which is almost everyone's favorite in the comment section, is box breathing, right? The 4-4-4 breathing technique. The first 4 seconds we inhale, then we hold 1, 2, 3, 4, then we exhale 1, 2, 3, 4, and again hold for 4 seconds. 1, 2, 3, 4. The 4-4-4-4 box breathing technique. And as I have told you, this technique is used by surgeons, this technique is used by military and army professionals, which will calm us down instantly in any stressed area or in any stressful work. You can use all these techniques before your physiotherapy or any physical therapy sessions, and even when you are in constant stress or strain, or before an important event that you are about to face. Okay, so third technique is one of my favorite technique, which is journaling, right? So here I gave you a template, that is 4-point template. In the first step, you have to just dump all the thoughts on paper, just write everything that comes to your mind. In the second thing, you have to just focus on one problem that bothers you the most. Am I right? And just write about it. In the third step, we tell our body that although we have many problems, but we are also thankful for many things in our life. That is, we express gratitude in the third point. And lastly, we move towards solution. The point number 2, which we had mentioned, we ask our mind to give probable solution. A solution can be as simple as starting reading a book, taking help from someone, talking to a friend about your problem, or just having a good breathing exercise to calm yourself. Okay, friends? So the next technique was the helium balloon technique, right? This is also one of the interesting technique in which we just focus on one part of our body that is causing us pain, or that is causing us MSK pain, musculoskeletal pain or musculoskeletal discomfort. And initially, we just tell our mind to give us one emotion that comes to our mind when we focus on that particular area. Suppose there is a knee pain, then we concentrate on the knee and we ask our mind to give one emotion. Suppose one emotion that comes to your mind is fear. So we write fear on the imaginary helium balloon. We inhale And when we exhale, we just leave the imaginary helium balloon in the skies. And as the balloon moves upwards, our tension releases. In this, I would like to tell you one more point, friends, that with one pain, for example, knee pain, it is not necessary that there is only one emotion related to it. Okay? So once you are okay with, suppose the first emotion was anger, again, if the pain is not reduced, again concentrate on your knee and ask your mind for another emotion which is related to it. Because our body is full of emotions, right? So there can be multiple emotions attached to one pain. So just give your body some time. Let all the emotions come and let all the emotions go with the imaginary helium balloon. And again, the last technique which instantly brings you back to present was grounding. The 5, 4, 3, 2, 1 grounding technique, in which I have asked you to make note of 5 things that you can see, 4 things you can touch, 3 things you can smell, hear 2 things, and 1 taste. Okay, so this is all about today's session. And for the next, I think are running out of time, but in the last 5 minutes, I am open for doubts. We can have some doubts, and then we can close session with a small surprise which I have for everyone. Hello, ma'am. How was it,
Yeah,
ma'am?
it was very beautiful, very wonderful. I also had a very nice relaxation session. Akash. So much
Thank you,
for
ma'am.
doing this. Any questions, guys? Because I have some questions. We asked our audience before the session itself that if they have to just ask you anything. So I have a couple of questions, but let's first take from audience and then I'll take it from my side.
Yes, ma'am.
Anyone, just post your question on the chat box, guys. Okay, so meanwhile those questions comes, let me read out the questions that the people from our community has asked. So, Akash, somebody has asked that what to do when you feel low, hopeless, down, uninterested in activities that once used to seem very exciting. What one can do instantly to kind of get better at it.
Ma'am, firstly, we need to find out the reason that why interest is reduced in that activity. Okay, if
Right.
you can enjoy any activity only and only if it interests you. So if you are no longer interested in that activity, then the first thing is you can just think about other which interests you. Or if there are any mental blocks, then you can practice a technique like journaling. With journaling, you can come to a solution that what exactly is bothering you in that activity or in that part, which will also help you to find solutions regarding the same.
Perfect, perfect, Akash. The second one is what to do when you constantly get worried about future.
So again, when I told you that the last technique, grounding. So when
Yeah.
we are juggling between past and future worries, the only thing that will help us is knowing the fact that it is only the present that matters. So all we have to do is just be in present. For that, one of the simple technique which we learned today is grounding. So whenever past worries and future worries trouble you, you can just do this 5, 4, 3, 2, 1 grounding, and you will instantly feel better. These techniques, ma'am, they seem very small, and people think that they won't work. But when we do it in our clients, and when you know that our all patients are giving such a good feedback for all these techniques. So although these techniques may look very simple, but friends, trust me, it has very, very, very big impact, not only on your physical health, but on your mental health as well.
Right. So we have a question from one of our subscribers. मेरे 70 days हो गए वेल्स पॉलिसी अभी 10% ही ठीक हुआ है पूरा सही हो जाएगा क्या? Okay. So Rohit, I'll take this question. I think I will be the right person to answer it. So Rohit, आपके पास अभी और करीबन 60 to 70 days है जहां आप और हुई पूरे ठीक हो सकते हो, ठीक है? बेल्स पॉल्सी जो है ये एक ऐसी प्रॉब्लम है जिसमें करीबन 90 से 120 दिन लगता है कंप्लीट रिकवरी आने में, राइट। आपको इस समय ध्यान रखना है कि आप अपनी मेंटल हेल्थ को स्ट्रांग रखें, और वहीं डॉक्टर आकाश ने आज हमें बहुत अच्छे इनपुट्स दिए हैं। आपको घबराना नहीं है, क्योंकि अगर आप घबराओगे, अगर आप चिंता करोगे, तो आप अपने ब्रेन पे ज़्यादा स्ट्रेन डाल रहे हो, आपकी रिकवरी में भी ज़्यादा स्ट्रेन डाल रहे हो। ठीक है, तो प्रैक्टिस करो, जर्नलिंग प्रैक्टिस करो, ग्रैटिट्यूड, मेंटल हेल्थ प्रैक्टिसेस कीजिए, और अगर चाहिए तो आप रेगुलर रेगुलर वे में भी जर्नलिंग, मेडिटेशन, इन सारी प्रैक्टिस को अपने लाइफ में इंक्लूड कर सकते हो, जिससे आपको चिंता जो है ना ये नहीं होगी, और रिकवरी भी फास्ट होगी। आई होप दिस हेल्प्स रोहित। या
Ma'am, on
आकाश,
this, can
would
I
like
add
to,
something?
yeah, please go ahead.
So I would just like to show, I'll just hide the name. Just today itself, I got one good review about a patient on Bell's palsy. So if you don't
Right.
mind, I can read it.
Yeah, please read it.
So the patient told me that, "Hi doctor, I'm doing very fine. As I mentioned earlier, my Bell's palsy didn't disappear, but it's totally disappeared from my mind. I'm feeling very good. I'm active in all the forums with no stress and pressure. Thank you for your healing and guidance." So just I mentioned in the session that one of the patient gave a good feedback on today. So this is what the feedback which we have got from a Bell's palsy patient. So ma'am, I think once we are patient and once we give our body that time, we automatically heal it, right? And as
Correct.
we know that some nerve injuries cannot be cured 100%, but if it's cured 100% from our mind, we automatically start living a normal and healthy life, right? Because
Absolutely.
as you always mention that with our age face changes, but once
Yes.
we just think about a policy or abnormality, we just focus on that and we forget about our 90% of healthy face and just focus on 10% of our face which
Correct.
is causing us trouble. So I
Correct.
think the most ignored factor is mental health, and I think because of health Q rehab it is also coming into focus and it will really help patients in the long run.
Definitely. Very rightly said, Akash. And I'll also add this up one more thing here. Uh, रवि, रोहित कुमार जी, आपको भी ये मैं बताना चाहूंगी, बहुत सारे हमारे पास पेशेंट्स आते हैं जिनको बेल्स पॉल्सी का प्रॉब्लम होता है, और वो एकदम निराश हो जाते हैं ये सुन के कि इसको समय लगेगा। ठीक है, अभी ये एक रियलिटी है। आप अगर इसको फ्लिप साइड से देखते हैं कि ठीक है, समय लगा तो कोई दिक्कत नहीं, मैं धीरे धीरे हर एक दिन मेहनत करूंगा और रिकवरी के तरफ काम करूंगा, आप अगर उस माइंडसेट से चलते हैं तो आपको ज्यादा बेहतर रिजल्ट्स मिलेंगे, कंपेयर टू अगर आप ये सोच के चलते हो या अपने दिन बिताते हो जहाँ पे आप ऐसे सोचते हो कि भाई ये मेरे साथ क्या हो गया, क्यों हो गया। राइट। सो पॉइंट ये है कि एक्सेप्टेंस बहुत ही जरूरी है। जो भी सिचुएशंस आ रहे हैं, आप उसको अगर उसको फाइट बैक करने की कोशिश करोगे, रिबाउंड करने की कोशिश करोगे, तो दिक्कत होगी। लेकिन वही अगर आप उसको एक्सेप्ट कर लेते हो, ठीक है हो गया है, अभी मैं नेक्स्ट क्या कर सकता हूँ, इस पे अगर फोकस करेंगे तो वो आपके लिए ज्यादा बेहतर होगा। Right. Okay, so that takes me to the next question, Akash. Right, so somebody is asking, do you feel that shoulder pain can be aggravated when you have mental health issues?
Yes, absolutely. There is one science altogether which is known as metaphysics. In metaphysics, what we learn is there are many emotions that are directly or indirectly related to our pain. For example, I give this common example that when one suffers or when one has many financial issues or worries about their finances, they usually have pain in their lower back.
Right.
If someone is not very good in relationships, then these things manifest as problems like high blood sugar or insulin deficiency in those patients. Similarly, someone who is feeling overwhelmed with responsibilities, they tend to have shoulder pain. So when we try to manage these emotions, when we give these emotions the right direction, then automatically the pain reduces along with our physiotherapy sessions or physical health sessions. So in this shoulder pain, I would like to say that one of the important emotion is feeling overwhelmed with responsibilities. So if you
Okay.
try to manage this emotion, automatically this pain will reduce with time.
All right. And out of all the methods that you mentioned, Akash, today, if someone who is having a chronic shoulder pain, which are the best techniques that they can practice?
Uh, Ma'am, actually, there are more than 100 techniques that which we recommend to our patients. So one of the
Right.
technique here which I can mention is mindfulness technique, and there is also one more technique in which we take a patient to into the stage of relaxation, and we
Mhm.
what we do is we travel deep into their nerves in their mind, and we try to relax each and every nerves there, because there are many emotions that are directly or indirectly affecting that area, right? So
Right.
there is also one technique, that is glove technique, in which we instruct the patient or to imagine that they have glove full of ice, and they are
Mhm.
keeping it on their affected area, and in that
Okay.
trance position, when they start using this technique, they automatically start feeling better. So yeah, there are
Obviously.
many techniques, ma'am, but because of limited time, I could only explain
No,
about
no,
five.
absolutely. I'm just trying to pick up certain points so that people can get inspired about it. All right. And then one last question I would just like to add, and this is related to sleep. Somebody has asked how much sleep matters to mental health and what one can do from a mental health perspective to improve the quality of sleep.
Mhm. So one of the best thing is decluttering before you go to sleep. That is journaling. Journaling just declutters everything. And ideally, when we see that we need around 7 to 8 hours of sleep. Okay, if we see that our sleep cycle is around 3.5 hours, one cycle. So if we calculate sleep in that pattern, so minimum we need 7 hours of sleep,
Right.
because 3.5 to 3.5, two cycles should be completed. If you
Correct.
are completing, or if you're not completing these two cycles, and if you get up early, then you won't feel that fresh when you get up. So I
Right.
think one cycle is around 3.5 hours, so we need minimum of two cycles, that is which brings us to 7 to 8 hours of sleep on an average.
Awesome. Thank you so much, Akash. Like, I guess this was one of the best sessions that we had in the entire day, and I guess everyone who has attended this will agree to be on this. I hope that you all found value in this. If you have any doubts related to your mental health issues, please don't ignore them. Please reach out for help. Don't ignore your mental health. That's the key message that we want to give you through all these sessions that we are doing at HealthQ Rehab. Thank you so much, Akash, for joining today's session. Yes, please
Yeah,
go ahead.
ma'am. Like as I had mentioned, I had one small surprise, that is
Yes,
on the
please.
occasion of Women's Day. I have one small poem which I want to dedicate to all the wonderful women out there.
Yeah,
So it is in Hindi, and I hope everyone is comfortable with it. The title of
please.
my poem is "वो नारी है, सब पे भारी है." So the poem starts like, वो ममता की मूरत है, माँ दुर्गा भी उसकी एक सूरत है. वो नारी है, सब पे भारी है. एक बेटी, एक बहन, एक दोस्त, एक पत्नी, एक माँ, सास और प्यारी दादी जैसे कई रोल वो निभाती है. पता नहीं कैसे अपने हर किरदार में हमेशा अव्वल वो आती है. वो नारी है, सब पे भारी है. वो घर की जान है, बुलंद आसमान और अंतरिक्ष में लेती उड़ान है. देश चलाने में भी देती अपना योगदान है. वो नारी है, सब पे भारी है. उसका प्रेम, उसकी शक्ति से सभी प्रेरणा लेते हैं. तभी तो धरती माँ और भारत माँ को माता का दर्जा देते हैं. हाँ, वो नारी है, सब पे भारी है. आरंभ की वो लाली है और अंत की माँ काली है. इसीलिए तो कहते हैं वो नारी है, सब पे भारी है. Once again, wish you all a very happy Women's Day.
Thank you so much, Akash. That was very beautiful. Thank you so much. And looking forward to have more such sessions with you.
Yes, ma'am. All pleasure is all mine, ma'am. Every time I speak on Health Q, I just feel overwhelmed. Thank you for
Thank
all
you.
the support and guidance which you always provide.
My pleasure. All right, friends. So thank you so much. We now move on to the next part of our session today. And these are, again, very interesting product pop ups. So, in morning session, you met Respire, you met Cure by Design. Now, I have a very interesting brand to showcase to you, and that is Anukul. Story of two very amazing women founders who have taken charge of health and well-being and a good quality of life of people who are suffering from injuries and ailments that makes their day-to-day chores difficult, especially one like clothing, of dressing themselves. And I am talking about Anukul. So, without wasting any due time, let me introduce you to Anukul founders. Please come on, guys. You can take over the stage here and just introduce yourself.
Thank you, Dr. Meghna. Hello, everybody. Good afternoon. I am Nalini. I am the co founder of Anukul. a brand that makes easy to wear clothing for people who have long term disability or short term physical immobilities. I would like to begin by giving everybody a warm wish. Happy International Women's Day. Thank you to all the ladies who are raising us, who educate us, who teach us, who lead us, and who empower us. The impact that you create is remarkable, it's immeasurable. Also, a huge shout out to all the men who make us feel loved and cherished every single day. All right. So today I'm going to talk to you about our brand Anukul. We make easy to wear clothing when it is difficult to wear regular clothes. Right? Like they say that face is the index of mind, clothing is a representation of our personality. In fact, if we think through this, clothing is in fact the most tangible form of self-expression. But what happens is sometimes life throws us into situations that makes it difficult to wear clothes of our choice and our preference. I would like to start by saying a personal story that led us into this brand. We have a very close family relative, a lady of about 60 years old, who was suffering from acute frozen shoulder. This was for about a year, and wearing clothes was a daily struggle for her. When she had to lift her arms to wear her kurtis, she will be left with tears almost every single day. And that was when we tried to find out if there are clothing that are appropriate for our conditions. But then we found out that there are actually no options at all. And through further observation and research, we found that suitable clothes are not available when people have casts or when people are having a joint replacement. For stroke patients, bedridden people, wheelchair users, and such. Right? So this led us to the invention or to the birth of the brand Anukul. So we are a brand that is run by two female entrepreneurs. Um, the word Anukul, many of you will be familiar with the word Anukul. The word Anukul, it means friendly, comfortable, convenient, easy. And this is the meaning that comes with a lot of Indian languages. So people who are watching this broadcast, if you can type in the comments what Anukul means in your language, and if you can also type the language that you speak at home, I am really curious to see what you people resonate when you hear the word Anukul. What does Anukul mean in your language? I am, for instance, my mother tongue is Tamil, and in Tamil, Anukul means convenient, easy. That's what Anukul means in my language. I'm curious to know what Anukul means in your language. You people can take some time to think about, make sentence with Anukul in your language, and you can type it. The meanwhile, I'll continue talking. So yeah, I have some products behind me. I'm going to show you those clothes as well. Now that we have spoken about the story behind our brand, I want to talk about the conditions where women especially require these kind of clothing, right? So, in fact, even if we think about it and dig into our memory, all of us know somebody in our friends and family who have at some point in time needed clothing that are not regular clothing, which required some modification, but such modified clothes are not readily available. Right? So let's look at women who will require such products. So let us say women who have had pain or a physical immobility, say women with arthritis, or say a spinal cord condition or a neurological disorder. How are you going to button your clothes? How are you going to wear the hooks in your, say, in your blouse, sari blouse? That's going to be a hassle, right? Let's take another condition where you have just come out of a surgery, or you need clothes which will give access to medical devices, implants in your body, or you need clothes that will support the drain channels, or you need clothes that will support your catheters or your urinary bags. We do not have clothes that help us in these situations. A very prominent another example is aging, right? senior citizens, super senior citizens who have reduced joint mobility or who have reduced strength in general and who constantly require assistance to wear clothes on a daily basis. The clothes that are off the shelf in the form of kurtis and t-shirts and saris, they are not helpful. And having explained so much, I'm sure a lot of us are curious to actually see how Anukul's clothes work. So I have behind me a few examples on how our brand can help your conditions. I would also like to say that at the end of after my demonstration, I also want to talk about a promotion that we are running in our website, but I'll come to that soon. This kurti that you are all seeing is a good looking cotton kurti. This kurti, what it does is it opens up completely from the front. It is a fully front open kurti, and it gets secured using Velcro like patches. These function exactly like Velcros, but we call it hook and loop. But the functionality is very similar to Velcro. So this kurti is extremely useful for ladies who have, say, a wrist injury. When you just have to insert your hand through the armhole, this kurti is going to come extremely beneficial to you. When you have a frozen shoulder, when you can't lift your hand, all you need to do is insert your arm from the side, and you can end up wearing this kurti. Also, think about cases where the person who has to use this has Parkinson's or stroke and will have difficulty in securing the buttons. All you have to do is bring together the Velcro patches, and boom, your clothing is done. And these clothing are made of high quality cotton, right? And you have to care for these clothes exactly like how you care for any other clothing in your wardrobe. These are all friendly inside the washing machine. They will stay with you as long as you want to have them, right? Let me show you one more product. This is another kurti which opens up from the top. So I have just managed to open the shoulder panel flap, and it opens through the side, and it opens all the way till the slit or till the edge of this kurti. Then we had a couple of customers who had just come out of a shoulder injury, a shoulder fracture, and a collarbone surgery. These were the clothings that they used for about 4 months, right? So this clothing allows you to wrap your outfit around your sling. So this helps you to hold your hand in exactly the right position without moving it excessively, and it also helps you from the reduced risk of re-injury. This functionality of ability to open it from the top to the bottom is there on both sides, right? So this is again a cotton kurti, and this kurti is also very friendly inside your washing machine. This does not leak colors, this does not shrink, and we just have to remember to close the Velcro patches when it goes inside. So the way the customers enjoyed it, or the relief that they felt after using this kurti during their recovery from shoulder surgery, it was immensely a huge point of joy for us, because it helped us understand that regular clothing may not be helpful at every point in time. You must be wondering, we spoke a lot about the top wear. We are also going to look at a couple of bottom wears. And you will also notice that Velcro is a recurring theme in our products. And this has been identified after a lot of research and discussions with people in the medical field. These come most handy when people are having a difficulty in their mobility. Okay, so this is a palazzo pant. Right, this is again made of good quality cotton. This has nice ikat handloom prints on it, and this also opens up from the top all the way to the bottom, and it allows you to wrap this one conveniently around the leg casts. Okay, For people who have just come off, say, a total knee replacement or a hip replacement, then you have difficulty in bending the joints around your pelvis or around your knee. This allows you to conveniently wrap and have a comfortable, normal looking outfit for your recovery. Right? So, um, again, a question. So, people who are attending this session, right? So, how many of you have had people in your friends and family who have gone through a temporary mobility issue which impaired them from wearing regular clothing? Can we have a show of hands, or can we have yes, me written in the comment section? Is there anybody who has experienced this? Or there could be times when the audience, you yourself, have gone through a situation like this. Have you encountered this? Interesting. All right, I'll allow you some time to think about it, because we always have had somebody in our neighborhood, in our family and friends, who have at some point in time needed clothing that are that are conducive to their condition, which the off the shelf clothing may not offer to us. And you may also ask me, all right, Nalini, you have spoken so much about ladies' clothing. What about the men? I was just, towing that line, giving the importance to the ladies, given it's the International Women's Day. But I'm here to show you some clothes that we do for the men as well. So this is a t-shirt, and this t-shirt also works in the same way as a side open kurti. So this t-shirt also has velcros that open up from the top and go all the way to the end. And I would also like to tell you that these velcros are extremely soft and pliable. They do not have an abrasive quality against your skin. These are perfectly comfortable and convenient to wear during your condition. And guess what? You can continue to wear this even after you become completely healthy. These may turn into a fashion statement at your workplace and amongst your friends. Once you've completely healed, you can go about wearing this in your daily life as well. So this is a t-shirt, and like this opens up from the shoulder panel all the way to the end. And this is an assisted clothing. So you may need somebody to help you come and wear this. What I have now achieved is I have managed to open this t-shirt into a book, right? So the person who needs to use this can conveniently insert their hand inside this, and the person who is assisting them to wear this t-shirt can come around, wrap it around them, and close the Velcro panels as needed to get a good looking t-shirt on the person. We have shorts for men and full length track pants for men, all embracing the same concept. Okay. All right. Before I introduce one more product, how many of us believe that while recovering from a physical injury, mental health is of supreme importance? How many of us believe that? All of us believe that, right? So clothing forms a very inherent part of our daily life. If we have the right outfits that help us to look good and feel good, it contributes immensely in our recovery journey. If our clothing become a constant reminder of our pain, our injury, our surgery, or our condition, and if that becomes the topic of conversation when we meet people, it's not a very helpful thing, right? We want to look good to inspire us to become much better at the earliest. And that's what we are trying to achieve through our brand, Anukul, right? I'm going to show you one more product. So this product is inspired from from a session that we had with people with spinal cord injuries, right? So these are people who were born with normal capabilities, but post an accident at some point in their life, they became paralyzed either neck down or waist down, and they became infirm, and they became completely dependent on an assistant to help them go about their daily activities. And the point that became the biggest issue or a biggest matter of embarrassment is, what do I do with my urine bag? I do not want to go about showing my urine bag dangling next to me in my wheelchair or holding it on my hand. It's a matter of huge embarrassment. We went to this center called as Soul Free in Tiruvannamalai. This center is run by an extraordinary lady called Preeti Srinivasan, who herself is a paraplegic. Right? She herself has lost her mobility capabilities, neck below, and she is running this center to help a lot of people below poverty line who are suffering from similar impairments. And a visit to that center that inspired us to think about a way for people with catheters and urinary bags. How do they hold the bags and hide the bag and still be able to participate in social events with pride, right? So this is the product that was inspired from that visit. So what you are seeing is a pant with a large sized pocket. It's a cargo pant. Cargo pants are fashion statements, right? And this is a fashion statement too. So we have an extra large pocket cargo pant, and inside this pocket is a zipper. Okay. And this actually allows the patient to put their urine bags inside the pocket and close the flap. And voila, the urine bag is present, but nobody gets to see it. So, participating in family gatherings, in social activities, is now a far easier thing for these kind of patients, and it instills a sense of self-esteem and pride in them. So, this is the concept behind our product. We want to take this to a lot of people who are at present, constrained by the clothing that they are wearing, but are unable to face the world. They are facing shame, they are facing discomfort and pain. There is an easy way to overcome that, and that's the concept behind our product. Is there anybody who has any question to ask us? We are happy to take questions. And I also would like to remind that we are running a promotion in our website starting 5 p.m. today till 5 p.m. on March 11th, the Tuesday. We are running a promotion of 10% off on all orders placed. Yeah. The link to our website, the link to our Insta handle, and the details of our promotion will all be available in the description and the links. If people have any questions, I'm happy to take the questions. I think we are good. All right. Thank you, Dr. Meghna, for this opportunity. I hope a lot of people benefit by this concept. Thank you so much. Everybody have a nice day ahead and a good weekend.
So, friends, thank you so much for going through this entire session. As you can see, all these products are here, and we have a unique offers going on, especially for our community members. So if you are not part of our healthcare rehab community, or else if you are part of our healthcare rehab community, feel free to reach out to us, because we are running these promotions, and we would be happy to give you and extend you these offers to you, so that you can get benefited, your loved ones get benefited from this product of comfort. On that note, let's move on to the second part of our session, which is by my Avni. So Neelam has already joined. I will just bring her on the stage. Neelam is from My Avni. My Avni is trying to solve for menstrual health of women. And this is a startup which is trying to make sure that each and every woman can take care of her menstrual health and hygiene. Over to you, Neelam. Very welcome to the session and looking forward to know more about you. Over to you.
Hi, Dr. Hi, Dr. Meghna. Thank you for firstly for welcoming me and making me part of the session. Good evening, everyone. My name is Neelam, and I'm from the team by Avni. So our brand is called as Avni Wellness. Please let me know if I'm audible and visible to all of you. Dr. Meghna, you can just guide me on that. I'm facing some connectivity issues. Uh, so I guess there is nothing, so I'll continue. Firstly, a very happy Women's Day to all of you. Um, it's a pleasure to be part of this session on such a special day. Um, a bit about my Avni. Who we are, what we do. I'll take you through that. Allow me 1 minute to just share my screen.
Hello. Hello.
Yeah, hello.
Hello. Yes, Neelam, you can just take over. I think you are able to.
Yeah, I will just share my screen.
Sure. So there's an option called as present in the bottom. You just have to tap on it.
Yeah. Uh, is it visible? Avni is a women's health and wellness brand. We are a almost 4 years old startup now, and we are into quality and safety tested care that every woman deserves. Uh, we have so in this what we offer is safety tested plastic free products for all women. Through We are also promoting livelihood generation and micro entrepreneurship to women who make these products for us, and we also have a support helpline where we support so many women like you through our through with their queries, with their questions, and all kind of support. Uh, Avni specializes in women product where we have period care range. That is what we started off with, and so it is run by a couple of founders. Sujata Pawar and Apurva Agarwal, who are our founders. Both are from the education healthcare background, and been in the pharma business for such a long time. They have founded Avni for like 4 years now. We are on a mission to empower every woman through health and information. And how do we do that? Is like first when I took you to the first pillar, that is our products. So in our products, I'll take you one after the other. First flagship product that we launched was a reusable cloth pad. This is India's only and first tested patented reusable cloth pad that is made up of 100% GOTS certified cotton, and uh, we have tested this to for its antimicrobial activity to remain for up to 100 washes. So you can use this product for up to 100 washes, which is almost 3 years in period. 3 years of periods. They are made up of, like I said, completely pure cotton. The topmost layer is pure cotton. The bottommost layer is cotton. It is pure laminated from inside, so no liquid comes out, no blood stains on the outside or your fabrics. The center layers are also cotton. absorbent layers which absorb all type of flow, including the cloths that we get during our heavy period days. And this the center of the top layer of this pad is antimicrobial treated, so it prevents you from getting any infections, and all sort of it prevents all sort of microbial buildup. This product is available in four sizes, which is starting from a medium size to a double XL size. So we have a one size for all. It is very easy to use this pad. You just snap it on your underwear and close the snap buttons on the back of the crotch. You don't need any extra pad with this. This is a self-absorbent pad, and you have to use it just like you would use any other disposable pad that is available in the market. So this is our flagship product. Like I said, we have sold more than 3 lakh units of this particular product already. It's been multiple times bestseller on Amazon. It's been sold out product multiple times on our website. And after this, we launched. This was the first in the basket, and then we launched many more products in the same portfolio. So this is an overview of our first product, which is an antimicrobial cloth pad that you can use up to 3 years, pure made up of pure organic cotton. I will come back to you and would like to know if you have any questions on this product, which you can take up, and then I can move to the next product. Dr. Meghna, just keep guiding me if everything is going well with the
Yeah,
voice
yeah,
and.
yeah. Everything is fine. You can continue.
Okay, so if anyone has questions they want to ask in the chat comments, I'll take up for this product specifically, or I will move on to the next product, and at the end also I can answer the questions.
Right. You can just move on to the next product as the comments keep on coming. We'll keep it at the end of the session.
Okay. So moving to the next product in the category, which I feel is um, another innovation that we have many USPs in this product. So you would see this looks similar to the first product that I showed you, but that was a cloth pad. This is a panty liner. So this is again a reusable cloth made 100% cloth made panty liner that is also made up of GOTS certified cotton, and the top layer, bottom layer, and the center absorbent core is also pure cotton, and this product is also antimicrobial treated, so this also prevents you from infections and any sort of bacterial buildup. You can wear this product for up to 24 hours because this is not for a period product. This is not for period flow, so there is no worry of infections. This you can just wear it like any other underwear that we wear, and this prevents you from that constant feeling of wetness that we get while due to sweat or vaginal discharge, mild leaks at situations that we get, or spotting days. These are four primary use cases of this particular product. And to bifurcate and to give you more knowledge about this use cases, spotting days is when like you don't know whether you may get the period today, but you may not get the period. Sometimes we use the whole pad and it just goes waste because we don't see any flow. So during those days or the light flow days at the end of the period, you can use this product to prevent you from that situations where the a few leaks here and there might stay in the panties, but you don't require a whole pad also to go with it. Then white discharge is very common feel that we get at times in our cycle. During those days, to avoid any wetness feeling or spoiling of panties, you can use this product. Then mild leaks such as during pregnancy or many women in perimenopausal stage and menopausal stage face issues with leaks. In general, wetness. Now there is like when there's a summer season while we're walking due to chaffing, due to many other reasons, we will get sweat. You can use this product during that. One another very different use case scenario that we have seen and we even recommend our users to use this product is while you're a new user of a menstrual cup and you're scared that it might leak at times, so you can have this as a backup for a menstrual cup. This product also, we are proud to say that we're the only brand in India who provides sizes in reusable panty liners. We have three sizes in this particular product. So there is no limitation for any women to use it. We understand that one size is not enough for everyone. And there can be sizes for pads that we get suiting each body type, then why should it be there for panty liners? This was the thought when we launched sizes in this product uh, a year and a half back. Uh, this product is also easy to use. You use it similarly like how I explained about the pad. Just snap it around the crotch and snap the button, the stainless steel button at the back of the crotch, and you're good to go. Both the products are very easy to wash. You just take the used pad or liner, soak it in a mild detergent for 10 to 15 minutes, hand rub it to remove all the discharge till the time you see clean water. After that, you can complete the wash via hand wash or put it in the washing machine and wash it, sun dry it, and it's ready for the next use. This was about panty liner. I will again take a pause for some time and like take up questions if you have for either a product or if not, I can move on to the next product as well.
I think the
So I
call
believe
is at the end of the call. We can continue.
yeah, I'll move on to the next one. Taking your third product we have, which is a like last year, almost a year into this launch, we launched a heavy duty reusable period plan. So this product we took almost 2 years to launch because we wanted to be sure of what we come up with. We did a lot of research, and this product is out after too many iterations. And finally, we are proud that we launched, and it was a bestseller as soon as we launched. You can see now also we are completely sold out with this product and soon stocking it up in a day or two. So this product is a pure heavy duty period panty, which is again made up of 100% fabric, which is bamboo cotton, and this period panty has a full coverage, end to end full coverage, starting from start till the back, from the front till the back. You get a full coverage. It has a thick fabric layer inside, which absorbs even the heaviest flow. The outer and the inner fabric is pure cotton. It's a four-way stretch fabric, so gives you a good elasticity for you to give that comfort fit. There are too many features. Like I said, the waistband is thick, which is flexy and gives you a comfort feeling and do not give those marks of a thick but like a thin but thick elastic band. It gives you a comfortable fit. Then there's a 360-degree coverage. Like I said, from front to back, it has a full coverage absorbent layer, so you can use it worry free in the night as well without worrying that there'll be stains, any stains on the bed sheet or on your clothes. It's a high waisted panty, so while you wear it, generally, as a user, if I feel during periods we prefer that we get some snuggy fit feeling near our abdomen. So a waist fit panty does that job. So this gives you that kind of a fit feeling. The core of the fabric is built in a way that it absorbs all kind of flows, and the side channels keeps you leak proof. It gives the entire leak proof protection. No blood comes out of these channels. So this is safe to use for 6 to 8 hours, even on the heavy flow days, and you can use it for more hours as well for during low flow days. We are only brand which has 8 sizes in period panties, 8 particular sizes starting from XS to 4XL. So there's a size for even the new girl that was just starting with her periods, and a size for even if you are of a heavy body type. So these sizes have been curated keeping the Indian body type in mind, which do not is comes in a fixed set of medium to XL, like S to L. We wanted to cater to all sizes, so you should not be left out from using such amazing product. So we have 8 sizes in this panty. This is also an antibacterial product because the fabric chosen to make this product is a self-antibacterial, has a self-antibacterial property. You can use it. This is safe to be used for preteens, teenage girls who have just started with the periods, or the periods generally at that age is very irregular because the cycle is still not set. There's no sync that is not set in the cycle. You can use it for all your flow types from day 1 of your period to day 4, day 5, whenever you feel comfortable. You can start off with low flow days if you do not use a reusable product, and then you can go and use it on your heavy flow days as well. During perimenopausal and menopausal times when you feel that irregularity in periods again, the irregularity in cycle, you can use this product, or you can use it for mild leaks as well, for a consistent day usage. Then pregnant women can also use this if you face the leak issues during pregnancy. So putting on a pad, changing it again, or just being worried about the stains, it takes away all that stress from you. You can just wear it like a normal underwear and you're good to go. Using this product is simple as you would use any normal underwear. You we suggest that you change it after 6 to 8 hours. And washing of this product is also easy like we did for the we saw for the previous 2 products. You just soak it in a mild detergent for 10 to 15 minutes, and then rinse off all the blood that is being soaked till the time water runs free. You you can hand wash it or machine wash it, and then just sun dry, and it's ready for use for the next cycle. You can see that it can absorb even so much of flow in one just in one time. So it is being suited and made in a way that it absorbs even your heaviest flow. It gives you a completely dry feel even after absorbing your flow for 6 to 8 hours, because the top layer the absorbent core top layer fabric is that it retains no moisture. So this was about our third product, Period Panty. These are our bestseller products that we specialize in, and we have sold more than 3 lakh plus units of these products. I've taken you through the journey of these and tried to cover all the points that we have wanted to cover in these products. And there are other ancillary products that we have, like disposable pads, mild detergent, natural detergents for everyday use, undergarment wash. We have those products also which I can take up, but those are just for, like, basic. Those are not the differentiator products. Good to have products that we have in our range. Our disposable pad is. Again made up of pure organic cotton. So when you use a disposable pad that is market bought, it is generally contains 90% of the pad is plastic. We all are aware of now about, so I will not go on that right. But tell you the difference about our product is this is made up of pure 100% organic cotton. The product, there is no chemical, no bleach to whiten the pad, no plastic layer. It's completely safe to use for you and for the planet. We have sizes in this product as well, comes in 3 sizes, and you can choose the sizes, configuration of sizes as per your own flow if you buy from our website. And there are 3 sizes available, from a regular size to an XL size pad. They come with individual disposal bag, so it's easy to carry and use and throw throw this product after usage. Then we have natural detergents, which are again made up of plant-based uh, ingredients. They again do not contain any chemicals, and they're safe to use for your fabric. They do not there's no chemical deposition through these detergents and your fabrics, which can cause itchiness, which can cause different sort of, because like this is an undergarment wash, for example. If I take and you use generally a soap or a regular detergent that's available in our house, so or antiseptic liquid. A lot of people prefer washing their undergarment with antiseptic liquid. So if you use that for your in intimates, then those will retain the chemical load on the fabric. There will be a chemical deposition that will happen, and more you use that fabric after every wash, the your vagina is very permeable to absorb everything. So it can absorb those chemicals and cause a long time health effects of that. The endocrine disruptors that we call them, these fall into those categories. So a safer alternative to those is our natural and plant-based laundry detergent, which are 100% chemical free and safe to use for you again and for the planet as well. So this was an overview about us and our products range. Now I will keep the last 10 minutes of this portion to interact with you all, to ask me about anything. I'm here to answer those questions, the pricing and everything you want to understand. I can take care of this. Pricing mentioned on the website that you saw is for the end customer that we sell to our through our website.
Thank you, Neelam. Thank you so much for sharing the details. We have got some questions from our internal community members. I'll just read through them. So
Yeah.
the first question is regarding the period panty. So the
Yes.
user is asking like for how many days or how many cycles we can use it, and then we have to listen.
Okay, so the period panty is safe to be used for 100 washes, or if I have to name it in the number of years, I would say because it's a period panty, you would use it more frequently than you would use a pad, just not limited it to periods. So I suggest that you use it in a year. I would say it is safe to use for a year and a half. Easily, and then you can maybe discard it, or if you feel that it is still going well for you, you can continue to use it.
Great. The second question is, does it absorb clouds? Is what somebody is asking.
Yes, so it does absorb cloths to if the gel. So cloths also has a differentiation when we say the regular cloths that we get on day 1 and 2, which all women get even in their regular flow, it will absorb. But if you're getting a cloths that are of a very large size, which in itself is an issue that you should get diagnosed with the doctor and get it checked, and then work on that thing. So you may feel that it is not absorbing very big cloths, but regular cloths that we get in every a regular flow cycle, it will absorb those cloths.
Yeah. And one more last question is there. Is it mandatory to use the cleaner that you are selling for the period panties, or can we use the regular wash soap?
No, so it is not mandatory that you use this cleaner firstly to set the context, but I would still say that you should not use the products that I mentioned while I was explaining that product, that the normal detergents that's available, antiseptic liquids, or the soap that we get, the detergent soap, because those products do contain a lot of chemicals, so that will deposit on your period panty as well, and it will your body will absorb those chemicals. So not mandatorily the detergent that I showed here on from us, but you should use a mild detergent. There are a lot of mild detergents available in the market, so you can use those. We try to make a ecosystem kind of a setup for our customers, so that's the reason we even have a detergent range, because if we suggest that you should use something to do a better care of the product, and which is something that's better for you, so we have a solution as well for them.
All right, perfect. Yeah. So that was it, Neelam. We got these questions from our community members. Thank you so much for joining this session. We will be sharing the links to purchase the products from my website in our community, so that whoever is watching can purchase it. there. Any message that you would like to give to our viewers on this Women's Day today?
So Women's Day is very special, but we in fact I believe here in Avni that Women's Day is not just one day that we celebrate women. Women is to be celebrated every day. She is such an amazing person on earth that we have in a lot of formats. So taking that same belief and same thing, we launched this particular campaign on our website, on our social media as well, where we call it as Women of Avni, where we want to come up with, share a lot of stories about so many women. They do not necessarily mean to be stories related to us, but just an inspiring stories to them. So since morning, I have met few women who whose amazing stories I've heard, and it feels so just so nice to be part of this community and just contribute somewhere. So I would say that just one message to the entire community. We as women have this thing that where we are very proud to call each other, ourselves as multitaskers. We like to do this, that for us, for family. But what I feel is all women need to realize at this Women's Day that yes, family is important, career is important, your kids are important, everyone is important. But don't forget your own self. Your first primary importance to responsibilities towards you. So take time for yourself, give it that do anything that you like to do that makes you happy, because if you are happy you will ultimately be able to keep everyone who matters to you in your life happy. So on this Women's Day, take that initiative, give importance to yourself as well.
Right. Wonderful. Thank you so much, Neelam, for joining. Thank you so much, guys, for listening to us. And that ends today's two product pop ups that we had lined up for our second half of the session, which was for Mayavni and Anukul. If you want to buy these products, feel free to reach out to us. We've already shared our contact details, and we will be happy to connect you to these brands so that you can directly purchase their products. Thank you so much, Neelam, for joining. Looking forward to
Thank you,
our
Dr.
conversation.
Meena, and thank you everyone for having me. Bye bye.
All right, guys. So this was an end of the product pop-ups, and now it's time for the last and the most awaited activity that is very close to my heart, which I absolutely love and adore, and that is pain-free workouts. Pain-free workout is something that we launched last year, April, with a key idea to help people who have pain as a very big challenge and they are not able to do their regular fitness activities just because of that pain. And our question was, what if we come up with a simple exercise program that allows them to stay active throughout their year without causing much damage or much strain on their joints? And that's how we started pain free workouts. Pain Free Workout is an online exercise program that is being live and being conducted by HealthQ Rehab from past 1 year. We have helped over 50 plus women suffering from different health issues being part of Pain Free Workout. So, today I will take this opportunity to give you a quick experience of how a pain free workout session looks like. Pain free workout session is ideally for someone who suffers from a musculoskeletal pain, who suffers from a joint pain, or is going through a joint degeneration, or if someone who is 35 and above and wants to ensure that they move each and every part of their joint without damaging the joints. That's what is pain free workout all about. So, in this session, we will be doing this pain free workout where the simple idea is to move each and every joint of your body without damaging these joints. So, let's join with me in this session while I set this up in 2 minutes and come back here. All right, guys. So that is now time to do our pain-free workout. I hope wherever you are, just stand up. We're going to do a simple set of activity here. Today we will do our neck, upper back, shoulder and lower back muscle exercises. All right. So let me start this. So first we'll start with our breathing practice. So place one hand on your chest, one hand on your tummy. Close your eyes. Breathe in, tummy goes out. Breathe out, the tummy goes in. Breathe in and breathe out. Breathe in, breathe out. Breathe in, breathe out. In, out. In, out. In, out. In, and relax. All right. So now, after doing this breathing practice, we are going to do marching in place. In order to do marching in place, just stand at one place and then just march for the count of 100. Let's do this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 2, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, and 100. Now just relax, 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 relax. Okay. Now it's time to do some simple neck exercises. So you're going to bend down and look up. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. Now we are going to turn side to side. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. The next is you have to turn your neck towards one side, rotate your neck, turn to the other side. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. Now we'll do the neck backwards. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. and relax. So this was the neck exercise. Now we'll do some shoulder movements. So again, keep your hands on your waist, raise your shoulders up and then down. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. Now rotate the shoulder from one side, then other side. Let's do this. 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, and 10. Anti-clockwise 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, and 10. Okay, now it's time for the next exercise. What we are trying to do is we are going to freely move the upper back. In order to do this, you're going to raise your hands up and then bring down, and then on the other side and then bring down. Let's do this. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. Now the way we did this way, we are going to do out and in. 2, in. What we are trying to do is we are going to move our shoulders and in rhythm to our spine. 4, 5, 6, 7, 8, 9, and 10. And relax. Next is we are going to move our shoulders out in the outward plane like this. So keep your hands like this and then spread it open. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. Now it's time to move our waist or is the pelvis. Now in order to do this, first we are going to rotate and free up our pelvis. We'll do some rotations. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And then we'll do anti-clockwise. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. Now we are going to keep our hands on side and then we are going to side bend in this way. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And relax. Now we have to move our waistline. In order to do that, keep your hands again on the waist, bend forward, and then come straight. We are going to do this again for 10 repetitions. Bend forward and back. 2, back. 3, back. 4, back. 5, back. 6, back. 7, back. 8, back. 9, back. 10, and relax. Okay, now the next is you have to keep your hands, legs out and in. Okay, we're going to do this for both the legs. leg out and in, 2 in, 3 in, 4 in, 5 in, 6 in, 7 in, 8 in, 9 in, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Relax. Same way, backward. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. And relax. So, isn't it simple? What we did was a simple, quick, pain free workout that is easy to do, ensures that each and every joint of your body moves. Now, what I did was a quick one, but if you want to go more into the detailed one, you can go where we move elbows as well, wrist as well, fingers as well. And that exactly we do in our pain free workout sessions, which happens every day, weekdays, Monday to Friday, 7 to 7:30 p.m. virtually. So whether you are in Ahmedabad or else in Bangalore or else even in any part of the country, you can join and take care of your activity levels. So what are you waiting for? If you want to join a pain-free workout session, we have a offer going on right now, which is you get a 3-month access to pain-free workout session just at rupees 1999. Yes, you heard me right. And this offer is live only for today. So if you want to grab this, make sure to reach out to us. I will share her number here. Just all you need to do is you need to call on this number 960-640-2843 and just sign up for pain-free workout. And you get one free trial session as well if you want to try it by yourself before starting it out. So don't waste your time, don't waste your energy, don't waste your money. Stay at home and do this workout. So that was it today's guys for today's session. Let me do a quick recap. Today's agenda of this entire event was to put a highlight on women's health, especially when it comes to musculoskeletal health and well-being. We started our session with a quick introduction, post which we had an amazing panel discussion where a team of physiotherapists, entrepreneur, journalists came all together and we discussed some key insights about the challenges that women face in her day-to-day life. Post which we had two amazing product pop-up. One was for Respire and one was for Cure by Design. After that, we had a very interesting talk by Miss Ritu Kapoor, who is a dietitian at HealthQ Rehab. She spoke about the importance of hormonal health and how nutrition can help one. Later on, there was an amazing session by Dr. Akash Shah, who is a psychotherapist at HealthQ Rehab, and he gave us some practical tips of managing mental health issues that an individual, a woman, goes through in her day to day life. The tips that he gave were absolutely practical, effective, at the same time, were very easy to do. And then we ended the session with two more product pop up. One was from Anukul, one was from Mayamni. Then we had this pain free workout session, and now here we are at the end of today's women's health session. Thank you, everyone who have been part of this entire avenue. This wasn't quick last minute plan that we made to organize this, but trust me guys, if your love and support stays, we will love to host these kind of events and activities for you as frequently as possible. So please show your support to us by subscribing to our channel, by being part of our healthcare rehab community. If you want to join our healthcare rehab community, it's absolutely free of cost. All you need to do is just visit www.healthqrehab.com. There you will get a button called as join community. Please join it, and you will get access to multiple sessions that we organize on a regular basis. You will get different discounts, different pop-ups on our community, with which you would be able to take care of your own health. On that note, I will wish you all a very happy Women's Day. Let's not make Women's Day a one day event, but let's make this as a practice of the entire year. Let's celebrate womanhood throughout the 365 days of the year. We all are special, we all are unique, and we all deserve a better and healthy life. And for that, we all have to stand together for each other. So let's stand together, united, rooting each other for their own growth, health, and well being. Thank you. Bye bye.